Welcome back to CDBG Advisory Committee meeting of February 17. We are continuing our interviews with our applicants for social services. Can we have the next applicant, please?
Yes, next we have ARC Family Center, Inc. for Create Freedom and Awareness Youth Transformational Seminar.
Please state your name and organization.
My name is Dr. Edward Kudaverdian from ARC Family Center, Inc. Honorary Chairman and Advisory Committee members and CDBG staff, I really appreciate this opportunity for our organization to present our request. My name is Dr. Kudaverdian. I'm the Executive Director of ARC Family Center, and it's 12 years that we are working with youth and servicing our, giving service to our community. Our program, this grant that we are receiving, the request is specifically to provide the CFA seminar for youth between the ages of 14 to 20 who are from low or moderate income families who otherwise would not be able to afford to participate in the seminar. The seminar will benefit the youth by helping them to build their emotional intelligence. Emotional intelligence is comprised of the following characteristics and abilities: self-awareness, self-motivation, mood management, managing relationships, empathy, forgiveness, making healthy choices. Our program specifically promote increased self-worth of students through their involvement in the program, teach youth teamwork and the ability to cooperate with others and promote positive peer relations, support youth become more self-sufficient members of the community, support youth to develop social skills compatible with a mainstream society, and improve interpersonal communication and leadership skills. We provided this service, with your support. We are doing this the CFA program for almost 4 years, and each year with the budget we got, we were able to serve 60 youth every year. And we have almost, I can say, 80 to 90% success. Every youth that does the seminar, after the seminar, they're able to have better relationship with themselves, with the parents, with the teachers, and because of the program, we always encourage them to speak in front of audience, the group, and that promotes their speaking abilities and leadership qualities that I think it's essential, very important for our youth. And also, through our program, they learn assertiveness that I think is very, very important for youth, especially nowadays in schools, to be able to protect themselves from bullies. And in case there are bullies in the seminar, they learn not to bully and respect others. And whoever is bullied, they learn assertiveness to protect themselves from that. I hope this year we will get, with your support, we can support more, at least 60 youth for coming year.
Thank you so much.
You're welcome.
We are familiar with your services, and we have visited the facility, I think all of us, and we were impressed with the passion, and Melina Sardar was very passionate, and we're very glad to see that the program is working. But as you know, with the cut of 35%. I wish I could say we could fund you more this year, but unfortunately that probably would be impossible at this point, but I think it's open for discussion later on. I will start with Mr. Cornell.
Thank you.
My packet here about the leadership program that you have as an alternative here, and I wanted to know approximately the percentage of your graduates enrolling in your assistant program for leadership training. The percentages of your graduates that go into that program.
For the leadership,
Yes.
after the program, you're talking about after the program?
Yes.
Yeah, generally 20% probably to 20 to 30% of the youth participate in, they become assistants. That when they are assistants, then we, after a few months, we work with them in leadership skills with them. They're able to participate in leadership program.
Okay, so it's only available to those individuals that have graduated from the program?
Yes.
Fine.
Thank you, Mr. Cornell. Mr. Sinanian.
Thank you. Hi, welcome back.
Thank you.
My question is about how you managed to cover the shortfall between the amount requested and the amount approved last year, because you are likely to have the same type of problem this year.
Generally, the way it works is, first of all, I do all the work that I do, and whoever supports me, we do pro bono work. I don't get any salary or anything. I just do it for the community. That's one way, and then the other way is we do fundraising. Especially this year, we are going to do a few big fundraisings that will support to cover the short, whatever.
The shortfall
It's a short, yeah.
You have like a rough number how much you fundraised last year?
Last year, about 5,000.
Okay.
But this year we planned at least 25,000.
Okay.
The way we planned to do the fundraising more aggressively. We are going to do more fundraising, and would you like to hear what we are going to do for the fundraising, or?
Sure, briefly, if you can tell us.
One of the generally the fundraisers that we do, there are small fundraisings, and we try to do big ones. The small ones, let's say we do with Subway or the Panda Inn, different restaurants. We get, let's say, a few hundred from them. But this year we are going to do Sing for Kids fundraising contest that we hope we are going to get fund at least $5,000, and then for this year we want to do a big gala that we are planning for 15,000
Okay.
to fundraise 15,000.
Okay, thanks. It's the last question.
Thank you, Mr. Sinanian. Mr. Oganessian.
Well, just a brief, very overall general question. How many kids would you say you help throughout the year? Is the number getting bigger? Do you feel the urge for more children? Do you feel the urge for a bigger place because you have more demand for this? I'm
Yes,
sure you.
generally we do more demand. I mean, there are a lot of people that, because we serve a low-income community, and there are a lot of them, especially nowadays, and but we serve just let's say at least 10-15 youth more generally. If you, let's say 60 through the program, we can serve 60 youth. Okay. But generally we serve more than that, and some of them they pay. for the service. They're able to pay. But
Thank you.
we have a lot of kids that they need the service, and we do as much as we can, I mean, to provide them the services.
Thank you.
All right, and the follow-up question would be, you're serving 100 kids, and the seminars are 3 to 5 8-week seminars?
8 weeks,
But the seminars are 8 weeks?
yes.
Okay. So the entire cost for the program, let's say it's $55,000, so you're spending about $500 per kid for that 8 weeks. I mean, that's the cost analysis for...
Generally, that 50,000 is about the services that we provide. Let's say
Right.
I see clients, I do, let's say we have parenting classes or DV classes, or I work with clients. I contribute that money to the organization. And your question was about...
No, I'm just trying to figure out what is the cost per child.
Generally, our program, the cost for a child is $295.
Okay.
And through whatever we get, actually, it's like we have to...
Match that?
Yes, we have, I mean, it's not enough for
Operational expenses.
operation for even the 60. If you, there's a 60 times 295 is
Not enough.
18,000, about 18,000. But we get 10,000. We got until now. When we started, CDBG provided us 7,000 to 8,000, and now we are getting 10,000 or 11,000. So it's not enough for covering the cost. We cover the cost, whatever is the short cost.
And I agree.
But that program, whatever the 55,000 you see, it's not about one program. It's about whatever we provide in the center, the fee services. That's how we...
Right. And the CDBG is obviously not funding the entire amount, so I understand. Okay, I don't have any further questions. Is there any? Thank you so much.
Thank you very
Dr.
much.
Kudareddy.
Thank you very much.
Thank you.
Thank you. Okay, I think for the next applicant, would you read the name, and I'll...
Certainly. It's Armenian American Medical Society of California, Glendale Health Festival.
For this particular organization, I have to recuse myself, and I am a committee member. And I would ask Mr. Cornell, the chair, to take over, and I hand the gavel. I have to...
Oh,
You mean the
okay.
vice chair, right?
The vice chair.
Okay.
Thank you. And I will be back.
You can sit here, I'll give you the gavel.
Just give me
There you
give me
go.
the gavel. So,
Have fun.
okay.
May I
Thank you.
start? Yep. Good
proceed.
afternoon to all the committee members, and thank you for taking the time from your busy schedules, and thank you for the opportunity for us to be able to apply for some assistance. My name is Viken Sepilian. I'm a reproductive endocrinologist and an infertility specialist in the community, as well as the president of the Armenian American Medical Society of California, which is the largest health-related professional society of Armenian-descended members outside of Armenia. The reason why we are here today is to request some assistance in organizing the Glendale Health Festival. The Glendale Health Festival now will be in its third year in 2012, and it's a community-based health event that was an expansion on a smaller health fair that our organization used to provide now for over 15 years. 2 years ago, our organization partnered with the local hospitals, Glendale Adventist and Glendale Memorial Hospitals, the Los Angeles County Department of Health, the Northwest Lions Club, and several other community health-related organizations to expand, as well as actually the City of Glendale Parks and Recreations, in order to expand this health fair to reach a more broad sector of our community. We changed the venue to South Glendale, the Pacific Edison Community Center, as we determined that geographic location has the highest proportion of individuals who would have the need for access to health care. And the organizing committee, which Ramella was a part of, the late Larry Zarian was one of the original organizing members, and several other prominent community leaders came together to bring this to our community. In its first year, when we launched it in 2010, we had approximately 1,200 to 1,400 individuals who came and took advantage and participated of this event. We had the festival itself has three components to it. One component is education and raising awareness of some of the medical conditions that most commonly affect our community members. And we did this through outreach programs, television programs, educational programs leading up to the festival, and also organized lectures that took place during that day. The second component of it was providing free medical screenings, and these were to some of the most common conditions that affect our community. That includes heart disease and obesity, diabetes, and various cancers. For women, we provided screening for breast cancer and cervical cancer. For men, we provided screening for colorectal cancer, well, both for men and women, colorectal cancer, and men specifically prostate cancer. In its second year, we're proud to say we were able to expand those screening services to more comprehensive panels of screening. The third portion of the festival is one-on-one consultations, and we had on hand multiple healthcare providers, from physicians to nurses to nutritionists and dietitians to exercise physiologists, psychologists, and so on, to provide one-on-one consultations based on some of the results that the attendees received on the spot, or if they just had a question or needed to speak with a specialist in regard to a certain medical issue. We also had a number of other outside entities, whether it be social services, whether it be WIC, whether it be domestic violence resources, and so on, that were present, as well as other free community clinics that these patients can be plugged in order to get the appropriate follow-up on their tests, or to be plugged in to initiate treatment. So 2 years in a row now, we've done very well. The second year, the attendance increased. Like I said, we were able to expand our screening capabilities. The enthusiasm of the volunteers also increased. Last year we had almost 100 healthcare professionals that were there volunteering, and I was very proud to see that of the last people who were still there on the premises as we were shutting down were actually the majority of the volunteers. So, in a nutshell, this is the event that we're asking assistance for. We believe that it is an important event. It's achieving an important goal, and especially with all the changes that are taking place with healthcare reform, there's going to be more and more people who are either uninsured or underinsured and are going to sort of fall through those cracks, and we're here to provide a need that the community has.
Any questions?
No questions. I think, thank you very much for doing what you're doing. I believe it's a very good service to the community. This is probably the most detailed and well put together presentation of the day. Thank you for taking your time and doing that. It's good to know your choice your career choice actually forces you to help the individuals, whether without any kind of personal gain interests involved. I know that because of a little bit of education from here and there. It's good to know that the doctors actually take their oath to heart and actually doing what they're supposed to be doing, not for just personal gain, whether it be monetarily or itemar. So if you have 100 physicians or 100 nurses and doctors out there that are willing to examine 1,500 people, I couldn't imagine examining 1,500 people or 2,000 people over a course of a day, especially for some of the exams that you pointed out. I believe it's a very well worth cause. I'm sure there's been some people that have been helped dramatically, or chances of success of a specific illness has been dramatically increased because you probably gave them early warnings or appointments and this and that. I personally would like to thank you for what you're doing. I believe it's a noble cause, and only thing I can say is if I'm on the board for the next 3 years, 4 years, or 2 years, whatever it be, I hope to hear some better stories next year, and some stories that change some people's lives from this. Thank you very much for what you did.
Absolutely, and we hope that we can bring those types of stories. And if I may, I mean, we did have some very, very acute findings where we actually were able to pick up some cases of cancers that people who just happened to drop in, otherwise they had no plans of getting screened, and those patients were able to get the proper treatment that truly saved their lives.
Wow.
And in particular, this year, and apart from cancer, we had one case of retinal detachment, which was picked up at the health festival, and this is an ophthalmologic emergency that if the intervention isn't done immediately, that person would go blind.
Wow.
And we were able to pick that up and actually have that patient transferred immediately to the county hospital so they could receive the appropriate treatment.
Amazing.
Yep, I have some questions.
Yeah, sure.
Obviously, it's a very ambitious project, and you guys have pulled it off for 2 years. I'm sure you're going to be able to do it third year also. And I mean, the scope of it is just tremendous. On one day, you see that many people and provide an essential service to people that otherwise may be left without it.
Right.
So kudos on that. Okay, but I do have a few questions. There were some weaknesses identified by staff, and I've seen that you've addressed those. I do have a question to you regarding the last one about low-income verification. I think your response was that we basically chose low-income area, and that's the verification. Are there any plans to make it more institutionalized? I know that it's for one day, and so there's limited return on too high an investment in that process. But have you been thinking possibly of making it a little more solid?
We have, and we've even thought about it going into the planning of last year's event. But we had to use the limited resources we had to really address this. And keep in mind, the attendees came from all kinds of backgrounds. I mean, we had, and including the volunteers as well. We had physicians who are Armenian, Korean, Filipino, Caucasian, of various Hispanic backgrounds. And same with the attendees. So when we did this, and we tried to do, we had a consent form, and of course we had to make the consent form in Spanish, in Armenian, as well as English. But taking that intake questionnaire, we felt like even though very easily we could ask what what their annual income is, however, to facilitate and move things along, we felt that if we had more resources, if we're able to expand that portion of the initial intake, larger, then perhaps next year we can do some sort of a verification. But we didn't. This far, we haven't seen how that would fit, in our delivery of healthcare. I recognize that, for purposes of, requesting funding, the granting body would want that information, and it is something that, moving forward, we plan on doing that.
And I have a couple of questions to staff, and I'll come back to you. In terms of these verifications, first of all, is the response satisfactory for the purposes of receiving CDBG funds?
Mr. Sinanian, so the response is they're currently not doing any income verification since it's not a requirement of their funds. If it is funded CDBG, there will be requirement for all 1,500 persons to complete income verification forms. Ideally, it is in a low-income area, but it's a citywide program and maybe even regional to some aspects, so it wouldn't qualify as just a strictly low-income program. It'd have to have all 1,500 fill out income verification forms.
So if we were to approve funds for their program, their usage would be contingent upon them satisfying this requirement?
Yes, and serving low and moderate income, majority of low and moderate income persons, majority of
would
Glendale residents.
Would the department be able to cooperate with them in a way, maybe suggest some working models for how this could be done in a cost-effective manner?
Well, we do have forms that are used for programs, and they can integrate some of the questions. Since they already have a lot of information probably in their forms, there could be added information as far as income verification, and there's clauses about,
So irrespective of... Go ahead, please. I'm sorry.
And they're required also to collect 10% of that has to be backup with W-2s or tax returns. So let's say it's 150 would have to provide actual eligibility documentation as well, as it is for all agencies for CDBG.
So yes, please, Mr. Duran.
You go ahead.
I was going to say, irrespective of how much we end up allocating, once they accept CDBG funds, they have to satisfy that requirement.
Correct.
Okay. Mr. Duran.
Committee Member Sinanian, this project would be somewhat of a calculated risk in that we would be expending, I believe, if some of the costs that are going to be CDBG funding are leading up to the health fair, to pay for expenses leading up to the health fair, and the calculated risk is if after the health fair we tabulate the income verification forms that were collected and we're not able to demonstrate that based on those forms, and assuming they're all complete. And one of the issues, as you know from all the monitoring reports that you've been receiving over the years, you'd be surprised how many times the agencies are unable to collect complete income verification forms. Then we run the risk of expending funds for activities that turned out not to be eligible because we weren't able to prove or demonstrate that over 60% were in fact low-income persons that benefited from the service. One way to mitigate that would be if in our agreement we agree that that funds would not be expended until after the festival, so that if in the end we aren't able to demonstrate that it did benefit over 6% low-income families, that we wouldn't have expended the funds, and therefore we would not have dispersed the funds when they weren't eligible.
Okay. Yes,
Mr. Sinanian, just to add one other thing, and I know this wasn't part of the staff analysis, but after staff did some more reviews, it also, and we were looking for the response, it also appears that some of these costs aren't eligible for the CDBG. For example, entertainment, photography, food, a large, part of CDBG is for some marketing, but it doesn't go to the extent that which is here. This is a very large event, and there are some costs that wouldn't be eligible for CDBG as well. So that's which
also actually brings me to my next question. Before I go to the next question, Mr. Duran suggested that one way to mitigate the issue of the verifications would be for the city to make approve the funds for allocation, but hold off on actually handing them over until the city's provided the verifications after the event. Would that be something that you'd be willing to agree to?
Yeah, of course. I mean, I definitely do see your point. I mean, obviously, a big part of the expenses are based on, and the more we promote the event, the more people we can get to to this health festival. And some of our promotion is done, very strategically, and we spend some money on. It seems like the Armenian community, they're more likely to be watching TV. Some communities we assess that television may not be the best. It may be some sort of a sign in the bus or at the bus stop. Or we even spent some money on Spanish radio through Univision to try and attract those. And these are some monies that obviously we would like to have ahead of time so that we can invest them. But nevertheless, we do plan on doing some of our own fundraising as well. We're not requesting the full amount, the expenses of the health festival, but by all means, we whatever contingency there is and the requirement that there is for CDBG monies to be released, we're willing to comply with that and make sure that we are demonstrating that this is low-cost community or population that it's serving.
Thank you. The follow-up question is about, I read the description of what the money is going to be used for, and before Mr. Duran even mentioned anything about it, that was my next question was going to be, what's the money going to be used for? Is it most of it, or some gauge of what the breakdown is in terms of food, advertisement, because apparently food does not qualify, advertisement does not qualify. So in essence, what would happen is even if we were to approve these funds to you, from what I understand, based on what the money is being spent on, we wouldn't be able to actually allocate those monies. Is that how it works?
As committee member Sinanian, if it would help, Mr. Creel actually has a list of those expenses that would be eligible, so maybe it would be simpler just to read those off, and we'd get a real good sense as to what would be eligible and what would not.
So read them now?
Yeah, we could do it now.
Sure.
Mr. Creel.
Sure.
Generally, personnel expenses, if they're directly part of the program, and I'm assuming this is the program director, which is $5,400, is eligible. Rental of tables is equipment. I think the printing of flyers and door hangers is eligible at $2,500. Then you have more of the medical equipment, which is the testing, the glucose, and all the diabetes, and all that, which is about $4,000. And there's some fees for licensing for $970. The supplies there, it's about $1,500 for Band-Aids and so on. We wouldn't be able to pay for a photographer, videographer, or food for 1,500 people out of CDBG. I haven't calculated that yet, but that's the amounts.
So those two items that you mentioned would seem like the only items that won't be eligible, and I'm doing the math, that's $16,000.
Television advertising? Not included.
And there's several ways that we reached out by television. Part of it was actual advertising. We're placing a commercial, but we also purchased some airtime, so where we invited some of the volunteers and physicians or nurses and whatever have you, and actually educated the public of what is diabetes, what is pre-diabetes, what is insulin resistance, and why is it important for somebody to have this specific test done. And we also informed the public that on the first Saturday of November, you are able to come and participate and get these tests that we're talking about free of charge, and as well, if the test results were abnormal, you will have the opportunity to meet with a specialist and discuss ways, and also there will be free community clinic representatives there on the site, so if you do need to make an appointment to arrange your follow-ups, that will be there. So even though it may be advertising, we like to think of it as the educational component that takes place before the health festival. They're in sort of a talk show, so to speak. We actually do it live, so if anybody has a question, they can even call in and ask questions and so on. So yeah, and I'm not sure if that qualifies as advertising or not.
While Mr. Carrillo is finishing the calculation, I just want you to understand that I'm not trying to put you on the spot. It's especially new entities that the committee's not familiar with, the city's not familiar with, usually get a lot of scrutiny for these specific reasons. Because, see, some of these types of expenses that you're looking for are not, for example, covered by CDBG funds, or there are specific requirements. So don't feel like, please, don't feel at all like it's a great cause, it's a worthwhile cause. I love it. I mean, I wish we could just say, yes, you can have it all.
Yeah. No, and I fully understand. I'm not taking. I'm willing. We're willing to do whatever it takes in order to make sure that it's a win-win situation.
Thank you.
And that's how we've operated in the past. And the organization understands that we're strictly volunteer organization. We do have an administrator who's on salary, but the whole board member, who's all physicians, we're strictly volunteers. Like I said, a lot of the expenses that if they are not covered, we're willing to fundraise. And by the way, on the food point, we did make sure that the food is of very good and healthy quality. It was a grilled chicken breast and brown rice and steamed vegetables and fresh greens and fresh fruit and some water. So it wasn't just a sort of the regular fast food that we brought. And actually, we worked with a catering company who's friendly to us to really, really beat down the price to the bare minimums, at the expense of affecting the friendship of this individual to us. But nevertheless, we really try to get it at bare bone prices and to make sure that the community knows that we are practicing what we preach. We're not just serving hot dogs and sodas.
Mr. Carrillo, an update on what the breakdown of those numbers
It's about approximately $17,370.
of non-fundable?
No, of funded.
Funded.
Yes.
So you say that again,
$17,370.
Eligible?
Eligible.
Yeah, I was unfortunately I was going over the advertising and everything. So only about 20-25% of the proposed budget is actually qualified for funding at best case, and at the same time, we're 35% less this year than last year we were. And it's a new company, so you're running up a very steep hill, which is not bad. We all got to try to get there. And I commend the way you proposed this. This was a very well put together package. Thank you.
I commend you for having done it on your own for 2 years.
Yeah.
Well, it's actually it's not just on our own. Like I said, there's a great committee,
Right.
A number of organizations that have pitched in, and we have a great dedicated group. We have Dr. Momjan, who's here with us, who a young physician to the community who's been instrumental. Hasmik, Carrie Baryan, who is our executive administrator, and really the organizing group has been a very, very passionate group of people. So it's not a one person job by no means. It truly, the volunteers have really been energetic and has made this growing year after year.
So just one last follow-up question. You heard that amount, maximum we can fund based on the application. The proposal is $17,370. Is that still okay? Is that something that's going to cause you to just cancel, or is that something you'll take? I think there's no guarantee that you'll actually get that amount.
Of course, and I think we're in a position that we will continue this regardless. It's just that with more funds, we're able to expand the services and our capability. So from the first year, we doubled our capability of offering blood tests, and also instead of just doing a total cholesterol, for example, we did a comprehensive cholesterol screening, which includes HDL, which is the good cholesterol, the LDL, the bad cholesterol, triglycerides, and total cholesterol, which gives the healthcare provider more information on how to advise this patient. So it's sort of based on the funding that we have, we're able to either expand the services that we offer or cut back on the services that we offer.
That's it for me, Mr. Cornell.
Okay. Doctor, I had a couple of questions.
Sure.
One, on your opening remarks, you mentioned about the healthcare, the new program that was enacted by Congress in 2009. I guess you could call it the Obamacare. My understanding from what I read in the media, that most of what you're doing is going to be covered.
Eventually, if everything works out, it should be. But, I believe we're a few years away from that, and we'll just have to wait and see. Some of that may be covered, but some of the other specific, more specialized cares may be rolled back. So we just have to see how it pans itself out.
Being medical, what you're doing, isn't that partly or some of it covered by the federal government without the Obamacare coming into focus here?
Some individuals have coverage, whether they have insurance or they have Medi-Cal or Medicare and whatever have you. But some of it are not. And some individuals actually may qualify for those things, but they don't even know it. And the first time they find out is when they come to us, and we do have a social service desk where it says that, well, you could have this for, you do qualify for Medicare, or you do qualify for Medi-Cal. So some of it is actually providing these services, and other parts of it is actually, empowering the people who come and attend to actually take advantage of the access that they are entitled to.
You mentioned before in your opening remarks, too, that you had applied in the past to CDBG funds.
We have not, no.
I was wondering when that was.
No, we have not.
Well, you haven't?
No.
Then I misspoke, and then I thought I heard you say that.
No, we have not. And
Okay.
I mean, we've worked with some organizations who do have funds, including the gentleman who was here before, and Glendale Healthy Kids, and we invite many community organizations to come and participate. Yeah, but us ourselves have not applied.
What is there a particular age group that you cater to here? Because I know many other organizations, like GMAC and so on. Here I have something for Glendale Healthy Kids. Is having something on March 27th. It seems to be pretty much a duplicate service of the services that you're asking us for at this time. Mm-hmm. So if you can elaborate on that a bit here.
Yeah, everybody's invited, all ages. It's an event that's open for the whole family. So whether it be a man, a woman, a child, a teenager, everybody is invited. Everybody's invited to come and participate. We actually, as an organization, do participate in Glendale Healthy Kids. Our physicians go. We have a few tables and provide services at their event as well. However, ours is open to everybody, all age groups, and we say it. Even our logo has a man and a woman and a child and so on. Yeah.
Any follow-up for the doctor?
No.
Okay, doctor, I want to thank you for you and your staff for taking the time and energy to present your program to us.
Thank you so much.
Thank you.
Thank you.
Thank you.
Mr. Vice Chair, would you like to invite Chairman? Oh, there she is.
Madam Chair, now that you're back, let me hand the gavel back to you.
Thank you.
That wraps up the.
I think that wraps up the interview process, and now we can go to the next item, Mr. Correa.
Madam Chair, at this time, what's scheduled is public comments. I don't have any cards, and I also did want to remind the committee that you had desired to go back to item 4A after the interviews and before the deliberations.
That's good, that's right. Long day, and I think we got to go back to that one.
Okay.
Should I read it into the
Yes,
record?
please, would you please read that?
Okay, item 4A is review and approve reprogramming Rosie Goes to Wall Street and Bookmobile fiscal year 2011-12 CDBG funds in the amount of $4,314.
I'd like to I'd like to make a motion, Madam Chair, so that we reprogram those funds, Rosie Goes to Washington and Bookmobile, from 2011 to the 2012 CDBG funds in the amount of $4,314, and according to the packet inside, 36 cents.
To whom? To whom do you want to reprogram it to?
Reprogram to this year's
Budget. I
This
think
year's
what we
budget.
have.
this year's funding.
No, we can't do that. It has to be this year. It has to be used by the end of this year.
That's what I meant, in this year's funding.
Okay. But
Okay,
who
I
do we
think as a
wanna-
committee, we can decide which organization based on our interviews. And based on the numbers provided to us, I think there's some organizations that are going to run out of their fundings, and I think they're doing a great job. And based on our interviews, maybe by looking at these numbers here, we can tell which organization would benefit the most from this few $1,000s. And again, let's keep in mind that the organization should be a frontline safety net program, prioritizing it by food and necessity and shelter. So if you need to go back and maybe look at this, or if you have the organization in mind, Mr. Sinanian?
I don't have a problem with the general concept of that, except I think relying on these numbers is not going to be very helpful, because as we noticed, and I think the staff can elucidate us some more, these numbers are really old at this point. These
When was this
go back
last
to like
updated?
December and November of last year.
Mr. Correa?
Madam Chair, the numbers are of December 31st. The next report would come in, let me see, I'm sorry, I apologize. No, it is updated as of March 31st.
Okay.
No, we can't be March 31st. No, I'm sorry, December 31st, 2011. So it's 6-month mid-year reports. Although some programs, as you know, start a little later in the year because they're school-based, so they don't actually start till September. Some programs started a little bit late, like the boxing program, the bookmobile program. So yes, there are some starting, but this is, I guess, a good starting point for. We do have programs that haven't spent all their funds or spent most of their funds, but again, it's because they usually spend money early and then use their own funds at the end. And some are vice versa. Some spend their own money and then use our money at the back end. So it really depends on the agency.
And based on some of the interviews, we see an increase of applicants with some of the organizations. Some organizations see, a higher need, a greater need for bigger funding. So, Mr. Organician?
We have a total of 22 organizations. Am I correct? 22 that we interviewed today?
We're looking at the last year.
Okay.
What was already funded.
Okay.
We're going to be using
Let's-
this few $1,000s
Towards
for
last
the
year.
calendar. The FY11.
Okay, let's
and
finish
12.
that and then we'll go on.
Can I suggest something? And this is very raw. I recognize that. There's a couple of groups that we funded last year who are truly servicing some very basic needs that just can't be
Ignored.
you can't ever throw enough money at. We're talking about food, talking about for example the ARC project with the lunches and such. Those maybe we can adopt those, because those are really easy to just. Catholic charities, Loaves and Fishes, I'm sure they can take some more money to spread some more food around to people
That's
who are
right.
hungry. And same with our own city's, the ARC project. I'm not sure what the specific name is, but you understand what I'm saying.
Right. How much did they request? Because that was this particular organization also raises priority to me. I mean, what was the amount requested for last year, and how much? I mean, I know that we granted 42,000, and they requested 75,978.
For loaves and fishes?
Clothes and fishes.
No, that's not.
Let's look at it here. Loaves and fishes. We'll have to take a look at...
Senior Services Program was funded at $20,992. How much did they request? How much?
Loaves and Fishes last year requested $74,132.
Okay, so 74.
They received $42,000.
Right. And Senior Services Program?
Requested $59,452 and received $22,000.
22 or 20?
22. Do you have 20?
We have 20 here on this chart.
Oh, I'm sorry. It's revised recommend. Yes, $20,992.
So as a next step, if you want to take a look at this list and see if there is another entity or other entities that sort of meet those really cutting edge
Criteria, the necessity.
that definition, and if not, I just say we just split the amount in two and give it, because honestly, we can really sit here and analyze for the next hour and a half about how to distribute $4,000 amongst 20 entities. I think that's going to be a huge waste of time.
I think if you try to even pick another entity, then the money's going to be so small it's irrelevant. Just split it between them.
I even think the 4,000 should go to just one, just because split it. What would be the impact of?
I say you give it to the elders organization
But
and
to
finish
counter
it up.
that, and I sort of agree with you, but to counter that, the amount of money this year we're dealing with is so small. $4,000 seems like a lot of money. So I think splitting it would actually count a lot, especially since there's no additional reporting requirement or additional
That's what I need
RFP
to find out.
requirement.
What would be the amount of work for the staff to split this 4,000?
Well, it depends if it's a city or it's nonprofit. Nonprofits would have to do a contract amendments, go through a new contract approval process with the attorneys, but it will take some staff time. So it's always, at this amount of money, it's best to have just one agency utilize the funds. And
I was thinking, because the elders, they were talking about they got a spike because of the daycare center shutting down within the next couple of months, and they received at least half of what the other organization received. I believe they can benefit best out
How
of
about
it.
one proposition? We make one last-ditch effort. Ask staff if there's a program that's like Senior Services Program, so fits that bill, so to say, and it's a city program. If not, I agree. Let's just give it to the Senior Services Program and minimize the cost to the city, minimize the cost to the entity that's getting the money, and move on to the 2012, 2013 budget.
The Youth Alliance would be one, I would say, right? The other one would be probably the police activities, right? But I still strongly stand on just one.
I think police activities are talking about like boxing. I don't know.
The other one,
Madam Chair, I have a proposal here. Before we start getting into this, let's tackle the ones that we're not going to fund and get those out.
Well, let's finish
We're
this.
talking about $4,000, Gary. Before we get into the ones that we're not going to fund, that's for the next year. We want to deal with the money that's left over for this year. So that should be an easier task. The other one's going to be messy. It's going to take a long time. Is there a response from staff? We're thinking, correct me if I'm wrong, food, shelter, those kinds of things, city related.
The Senior Care Management Program would be one of those frontline safety net programs. It's a program that has demonstrated effectiveness. Administratively, it would be easy because it's a city program and we don't have to be amending contracts and having them reviewed by the city attorney. The community demand is very great, and it's growing all the time just by sheer numbers of seniors and low-income seniors. What was the other option?
I think we talked about the Youth Alliance.
Loaves and Fishes. Yeah, Loaves and Fishes would also probably meet that same criteria, except administratively it would require a little bit more work because we'd have to amend the agreement with Catholic Charities. But either one of those would be good choices.
Mr. Corey?
Not to add more to, but these two projects did come from the city funds as well, and so it's the balance of funds that makes a difference. But certainly senior care, as Mr. Durant pointed out, is important. One of the things I know they ask for and don't receive is some kind of funds for some of the seniors they see at the home visits, and whether it be a microwave or in the summer it's a fan or it's during the winter a heater. There's a lot of these expenses that the city does not have funds, and they've asked for these funds from us before, and we're not able to provide that extra money. So a lot of it could be spent much quicker through the senior care program than some of the other programs out there.
Again, we don't want to favor one organization because it would be an easier step for the staff, but just reviewing everything and the demand, the growing demand for the services for senior programs, and I think the amount of money funded to them, last year, I would feel comfortable allocating the entire amount. So
To senior services.
to senior services program.
If you'll move to that, I'll second it.
We have a motion, Mr. Cornell?
Yes, I'll make the motion here now that we're pretty fixed on the program that we want to expound the funds into, and I make the motion that for item 4A, for the reprogramming of Rosa Goes to Washington, the Woboka bill, for the 2011-2012 program of the amount of $4,314.36, we program into the Senior Services Fund, Senior Citizen Service Fund.
Would you second that?
I'll second it.
Okay,
Call.
committee members Cornell,
Yes.
Oganessian,
Yes.
Olivares is absent, Sinanian,
Yes.
Chair Markarian.
Yes.
This is great because usually I personally complain about the city taking a second swipe at the money.
This was already collected from the city project.
Wasn't this the one where we're talking they were only
Rosie and
16%
Miss-
away?
Huh?
Wasn't this the organization we're talking when I asked it's only 16% funded by us, the rest is from the city? Was this it?
That could be
No.
any one of them.
I think that was a youth employment program.
Yeah,
Oh,
that was-
that's right. I was like, what isn't it? Okay.
Next item, Iris.
We would be going back to item 4B for deliberation and approval of funding recommendations. We did have a break in the schedule, if you would like to proceed with that. Otherwise,
No,
it would be,
we don't need to, if everyone's okay.
Let's go, because I know you have a deadline, you have to get out of here by 5.
So we can move forward. We already took the break.
sure.
With the deliberation part.
Sure. I'm going to put the spreadsheet up so that we can work together on these.
Hold it. Okay, so before we start the deliberation and the discussion over different organizations and the amounts that we would allocate, I would like to go over what's available and what the request is. So what's available currently to fund these different organizations? We have $290,000 available. Plus, the 4,000 is already allocated. So $290,000 for the year 2012 and 2013. And we have request of, I can't see it well, it's 1 million, what's the total amount request? It's over $1 million. $1,028,607 total social services funding requested. So we only have about 30% of the total amount requested. So we have to really look.
Is that more
Careful.
readable? Is that more readable, or is
A
it
little,
worse?
little
fine.
bit, yeah, a little bit, much better now.
Yeah, it's a little better.
I say we start by voting for organizations we do not think
Yes.
should receive anything. Get them out of the picture first. If there
The
is
ones
any,
that we have doubts about, we can, let's
Oh, yeah.
just
get
get those.
them out of the list first.
Let's start with those.
We can eliminate some of the organizations that they're not meeting the criterias and they're not meeting the requirements.
Which one is that?
We're going to examine
I thought you...
based on what we have
Yeah.
and eliminate some of the organizations that are not meeting the criteria.
Can think of two.
Go ahead, Mr. Sinani.
One of the programs is a new program. Well, actually, both of them are new programs. One is a city-sponsored program, the one that Mr. Engel presented in a very eloquent and masterful way, which yet does not qualify for CDBG funding. I believe. He made a very compelling argument, just not compelling enough to pass muster, because fundamentally speaking, it did not meet the requirements of CDBG. I mean,
Right.
food. I don't think the actual food was the goal of the program. It was the act of growing the food, of engaging in that.
Right.
That act of whatever, tilling the land and seeing your work come to fruition. That was the point of the program, and I don't see how that meets CDBG.
Right, and that is number 3, Habitat for Humanity, Maryland Mini Park. So we're looking at
Yes.
the requested amount is $46,840, and we can take a vote on that. And I don't know if anyone wants to comment. We already made our comments. So if you would like to take a vote or
You want to comment?
comment.
I don't think we need to take a vote as long as we have consensus.
Okay, consensus.
Fine. I concur with the number 3 there. Yes, it's a worthwhile program. It is. If we had the budget for it, I would say yes, but we don't, and it's not a priority. And so I
I don't think it even meets our criteria anyhow, so it wouldn't even be a...
It doesn't meet the criteria for the priority or a safety net program at this point. It's a valuable program. I think it's going to do a lot of good for the community, bringing them together, seniors or youth. But at this point, when we're dealing with such a large cut, I just feel like, there are other organizations that we can that can benefit from the funds. So
It seems like a luxury at this time, unfortunately.
Yeah.
True.
But it is.
okay, so Iris, maybe we can have a
So we have consensus on that
Consensus.
item, on number 3. Another one here that I would like to pass on is number 10. Number 10, the Your Health Services Programs.
What?
Yes.
I didn't like the presentation. Are there other means that we can address this in the community? The representative was not a good representative as far as appearance and being able to answer our questions. And for that, I'd like to pass on number 10.
I agree with you. I don't even think they actually needed any of the money.
To be frank, if they needed the money, they would be.
They would have
better
been here on
prepared.
time.
They would be better prepared. They would be here on time. And as a general comment, I hate doing this, but I want to make a point that groups that are seeking money from this body, they're coming to us asking for that money. They need to come prepared. They're not doing us a favor by appearing or not appearing. Staff doesn't have to go hunting after them.
That's right.
Sure, things happen. Sometimes there are unforeseen circumstances. First of all, I wasn't even told why they were late for hours. And secondly, they're utterly unprepared for the presentation. So in the future, I hope no one does that again, because I would, just based on that, I would be reluctant to fund the group.
True.
Just shows lack of responsibility.
Plus, looking at their tax returns, I think we can ask them for some money. If you
Okay. We have consensus on that. Madam Chair, one other one here. It was the last presentation by the doctor on number 22. I think it's a good program. We do have other organizations in the community that do provide their service, like your own hospital there. They did not did not attend the mandatory pre-bid conference, and I'd like to see perhaps that one scrapped.
Which one? I'm sorry.
That's number 22. That was the last one.
You know what? I don't agree with that. And the only reason I don't agree with that, because I believe it really is a worth. Unfortunately, we're way below what they can actually qualify for, just for CDBG funding. I believe they're asking for, what, 68,000, if I'm not mistaken?
No, 49,000.
Sorry, 49,000, and they actually only 15 or 16,000 of that actually qualifies for CDBG funding. That's the unfortunate thing. But giving somebody an opportunity to be able to go get some kind of health care for free with absolutely no obligations and no visits, I believe, he said it himself, they got 1,500 people that attended the first 2 years. I think it's a worthwhile cause to at least warn people of some kind of problems they may have in the future. I think I see other programs here, such as, for example, I'd rather get rid, as much as I hate to say it, and I was raised in that program, I'd rather get rid of the boxing program now. Because there's 4 children attending. It's taking time away from the officers, personal time. It's taking money away from CDBG. And it's not, if it was affecting 20, 30, 40, 50 children like it was before, I'd definitely say keep it. But if it's only affecting 2, maybe 3 people, and they're hoping some people are going to show up and take advantage of the classes, I'd rather not take, especially the money that we have, don't take chance with hoping that somebody's going to come attend, and get rid of some of those.
There are other programs in the community, Alex, that do have this. GHK has this. They're having something next month for the children. Various services, eye, doctor, dental. So we do have those services available here in the community, more than a once-a-year basis than the program that's going to be offered by the General Health Festival on a one-year basis.
And just so that I get some clarification, Glendale Healthy Kids program, but do they provide the services that they do to all age groups?
Just for the children.
Just for the children. So they're not really, it's not really the same service. I propose, something in between, not cutting the tree and then not getting rid of the boxing program by any means, but at the same time not getting rid of.
We can come back to and discuss that more.
Not getting rid of 22 either, because again, in the past I've seen this happen. New entities come in. We are almost always under budgetary strain. Granted, it's never as extreme as it is this year. And we often end up, I shouldn't say often, I think pretty much every time we turn them down. We turn them down, and it has a freezing effect on this process, because then it's almost everyone else gets grandfathered in, no new entities are entered in. Mind you, 2 other entities that were new, we already decided to cut for objective reasons. But this does seem like a different kind of program, worthwhile program. I suggest we put a number up there and then revisit it. We've always done, that's what we've done about contentious entities, contentious applicants. So I say, I don't know, $15,000 up there. They only qualify for $17,370. I say that let's put up 15, and we'll go back to it once our situation is dire.
I'm agreeable to that.
I cannot make a comment, so.
I'll agree to that. I don't have a problem with that.
That's all.
You know what we should do? One by one, Romelia, if you don't mind, Madam Chair. If you just go through it, we'll say stay, and if somebody objects to any of it, we'll talk about that specific one rather than just blurting out.
What do you mean stay?
I think we're not done eliminating. Are we done eliminating?
No.
Because there is. Or
That's
you
what
want,
I'm trying
you're
to say
saying
is
just to go through it.
Just go through it, and if somebody objects to keeping one of the programs on, then...
Oh, you mean keeping
Yeah,
period?
because we're just jumping from number 10 to number 22, and it's getting a little confusing.
That's the end of my elimination, the three that I just mentioned.
Yeah, I can't think of any eliminations either. So if anyone knows
I thought the
of-
boxing. I agree with Mr. Oganian that the boxing program it is a wonderful program, but it just seems that they don't have enough applicants, and there isn't enough interest since the venue changed. And for us to fund something that is not stable enough, whether this program is going to move forward, the funded amount last year, it's still sitting and has not been really used effectively. So for me, that would be another elimination, even though I hate to see that. But I really, really think that the YMCA can move forward with the program because they're passionate about it, but this is not supposed to be. I mean, I don't see CDBG funding this.
So that's
would
the
be-
PAL program.
Oh, yeah. There is another one I'd like to eliminate. As much as I hate to say this, and I mean that, but I don't think we're getting any use out of it, to be honest with you. And for the exact same reasons you just pointed out for the boxing program. I was thinking maybe we can get rid of, at least for this year, and then maybe put it back on the agenda next year this time, because the budget's so tight. Maybe the bookmobile for kindergartners. Because I don't know how many kindergartners, and them themselves are only saying they don't have the machine anymore. There's only about 100 2 to 3 year olds using it, and they don't carry materials for anybody over 3 years old. And we're spending $7,000-8,000 for maybe for children that could use the same library services that are around. It's still free.
Again, just to elaborate on what you said, I think the amount that we have to work with and what the cut actually affected would result in a reduction of staff, I believe. So we do not want to have too many small programs that are funded very small, which is, it's going to really put a burden on staff, especially with having that one reduction, 1 or 2. So we really want to move forward with those organizations that actually are going to be funded larger amount or have requested an amount that is considerably that would make a difference for their program. So $7,000 for staff to go through all that paperwork, and again, I don't know how passionate you are about the program.
I'll address both if you once
Sure,
you're
please.
ready for me to. Yeah, I'll go with the library services, mobile library services. I actually questioned this program
Last year?
years ago, last year. I'm questioning it now, to be honest. Amongst all the reasons that you've stated, I questioned it because it's a city program. They're taking a second crack at the money that they've already taken a first crack at, and I keep saying they. It's no disrespect. What I mean is, the lion's share of the money, CDBG funds that have been allocated to the city, have already been pre-designated to city entities. So this applies to all the city programs, but to the extent that we can diminish the funding to these programs and alleviate the financial strain on the other programs which did not have one go at the money already, I think it's fair. So my recommendation would be yes. I'm okay with eliminating funding for mobile library services. It's drastic. Don't think of it lightly. We're eliminating these programs. It's no joke.
No joke.
But again, the money that we're dealing with, it forces us to make these decisions. That's the library. The boxing program, I still have faith in it. I don't want to see it eliminated, to be honest. I can compel myself to agree to a lesser amount, but to be completely eliminated.
How much were you thinking?
Well, $10,000, I think that's...
See, but $10,000, we have to also think about the amount of work that's going to create for not a stable program. what is the amount of work the staff has to
I think
do?
when I asked Sergeant Gilkerson, I think I told him that it's probably going to be inevitable that you're going to have less money, and he said, we'll make do. We've done it in the past, and we'll make again.
And I think having, correct me, Mr. Corella, but now that is kind of collaborated with YMCA, wouldn't that be something that we're hoping YMCA would take over the cost and all that? Do you think that
Well,
would be a possibility?
Madam Chair, I can't speak for the YMCA per se. The funding the amount of funding you give is actually for a 9-month program. Actually, it's an 8-month program. And so it's not even a year-round program. So it's already cut pretty deeply. And if there's more cuts, down even 10,000, that's 1 day a week for 6 months. And so the cost effectiveness is not really there. I don't know if the YMCA could pick it up, but certainly they have the facility space, and maybe that's something that they can look at as far as continuing it without the CDBG funds. But I can't necessarily say they will pick it up. And
If I remember correctly, the YMCA rep, and of course this is all words, it's not like someone signed a contract or anything like that. The YMCA rep specifically said, we're committed to this program,
Yes,
we're going to see it go through. So I think, I'm saying let's cut some funding, but let's give them enough oxygen to stay alive, and I think YMCA will step in and foot the bill for the balance. At the least, I request that we put up $10,000 there, and if we're really, really hurting, we go back to it.
Okay, let's,
I'm agreeable to that, 10K.
all right, let's do 10K, Iris.
And 0 for, I guess Mr. Cornell hasn't spoken on the library.
That education factor hurts. We're going right down the core of our central concerns here, which is South Los Angeles and the low to moderate income families, which Cerritos does incorporate. So I'm reluctant here. It's a very small amount as it is. I like to see it kept at the same fund as we had last year, and we can revisit this as we go further down the line.
Gary, let me ask you, may I?
Sure.
Madam Chairman. It's Cerritos, and it's a limited amount of money, and it's basically books for preschoolers. I have a child in preschool. I appreciate the importance of all that. I don't take this lightly. But why can't those books just be housed at Cerritos Library? They do already have a library. Eliminate the expense of going back and forth and dealing with that issue, period. All I'm saying is that, remember, in the last years we had this discourse, was there even a library at Cerritos? Cerritos does have a library.
Yes.
We have that established. That's not an issue. So I know you feel bad about it. I feel bad about it. I feel bad about cutting anyone's funding, except for people who don't show up or can't even make a presentation. But I think at this time, again, Gary, any amount we cut is going to hurt. It's going to be hard, but we just got to man up and do it. Sorry, that's why. I don't know if I compelled you, if my argument was compelling to you.
You know what the problem was? I'm sorry. If they were trying to reestablish a stronger program by putting better machines out there, better libraries out there, instead of just going after 2-year-olds and 3-year-olds, just all of high school, junior high, and everything, then that'd be a completely different story. But we're bringing the market down to a very small population of individuals that are actually going to be using it. And she herself said maybe 100 kids take advantage of it on an annual basis. Now, on a drastic cut like this, those 100 kids unfortunately will have to fall into the rest of the population and use the public library or local internet, or parents have to buy themselves those $2 those books. That's pretty much it. You know what I mean? You can't let 200, for example, 10,000 senior citizens suffer because there's 20 2-year-olds that want to have a book to start reading. Regardless, probably the most important thing is to start the kids off reading and writing at an early age, but it's not the
Safety net
exactly.
program.
It's not a safety net program at the present time, unfortunately.
So do we have consensus to take that out?
Acquiescence, I don't concur, but for the sake of being unanimous here and being all in accord, I'll go along.
Thank you, Mr. Cornell. Okay, maybe we want to start. I don't see any other that we want to eliminate right now. So let's start with the top. Homeless women and children. Door of Hope.
Which one are you on, number
I'm
4?
going from the top. That way, the first interviews. Number 1.
For one? Oh, okay.
Door of Hope.
Yes, I'm for staying as right at this time as last year's funding.
Last year was 19.
84.
Yes,
It was
19.
19.
Make it 19 even.
Madam Chair, just for rounding purposes, can we just use round numbers? Is that okay if you say 19? Because there was a, remember, a
No,
cut,
let's
slight
use
cut.
round.
and if
Let's
we-
use round numbers. Let's
Okay.
put 19. I'm okay with 19. Mr. Oganesian, 19 sounds okay for now?
Sounds fine now, but I remember, please, we still have 20 organizations to go through, and you have to cut $600,000. If you're cutting $700 per organization, we're going to go through the whole list and come back from the front and go through it again and come back from the front. So take your deepest cuts now, so we don't have to revisit the list 20 times.
I agree with that because that's going to become inevitable.
It's gonna be
I
coming
think
up again and
15
again.
is a real number we should put up there, and then come back. I'd rather come back than come back and say,
Exactly. Because I'm sorry to say that, but if we're going to take out $600-700 and we need to cut $700,000, we're going to be coming back
I
a
think
lot.
Mr. Correa has a...
Just another comment, as we spoke earlier about the cutting too far deep, and we know that these are deep cuts, kind of defeats the program. I think one of the recommendations we had was funding a minimum 20 to make them very cost-effective. I know that's very challenging, and it's great to give them something versus nothing, but something really will not help them. In this case, it will hurt another agency if you fund them at 75% of their capacity. We're really looking at capacity and having them funded at a level that can really operate funds. And I know giving $4,000 or $5,000 is great, but it's not assisting the overall goal of providing these programs.
So in that case, it sounds like the boxing program should go, because that's going to be funded. What did I recommend? 10,000.
That's, yeah.
And even last year, Door of Hope was not funded at 20,000. Funded at 1984. Let me get this straight. Is it for them? It's going to be just going to lose its viability. The program is going to lose its viability, or is it that the strain on the department, considering how small the program is, it just doesn't make sense?
Combination of both.
I think it's a combination of both. I mean, administratively, funding the smaller ones, it's just really challenging. And then again, agencies are, and you'll see that, and I maybe should have expressed that earlier, you see a lot of agencies asking for more money than last year simply because they've been cut from other sources, and the biggest source of funding cut has been private donations. So they're really trying to make up some gaps there. They're not asking more money because they want more money from CDBG or they'll think they'll get more. It is a reality that the private funding has been cut significantly for a lot of the nonprofits.
I just did a rough look at the money that's being requested by the entities. A good chunk of groups be cut out completely. 1,
We
2,
go through it.
3, sure, yeah, sure. I'll read them.
No, I'm just saying, let's go. Do we want to jump?
What I'm saying, let
okay.
me explain what I'm saying. Mr. Carrillo said that there's like a criteria that's recommended that anything below 20 doesn't make sense, shouldn't get funded. So as I'm looking at the requested amounts, I see 1, and then on the other page, they're all on the other page, 2, 3, 4, 5 entities that don't make a cut. So we would be cutting 5 programs out of the CDBG program.
We already did cut 3, and I think there are only 2 left that we're going to come and revisit. Right? I mean, we only...
yeah, you're right. We cut
So it's
2.
really-
We cut 2. Oh, we cut the Right, so 2 more programs. I mean,
So
if
2
you
more
want
programs.
to, if you want to stick to a criteria and get rid of 2,
I don't think it's not like we're sticking with the criteria. I think those 3 that, we eliminated, not only they were under 20, but they didn't meet the criteria. So I think that's how we're going to move forward. If they're under 20 and they're not meeting the criteria, it's just making it easy for us to cut the.
let me ask, I got to ask a question to the staff. As I look at the current year funding, there is 12 groups that were funded under $20,000. So apparently they were able to remain viable, and staff was able to maintain the programs or supervise the programs. Is one of the issues the fact that we're losing a staffer because of the drastic cuts in the staffing funding? And I know that's the case.
Yes, Madam Chair, committee members, because of the cuts to administration, we are also losing some of our administrative capacity to continue to do the job that we do to protect the city's liability with HUD, to ensure that we provide enough technical assistance to the agencies, that we are always in compliance with the rules and regulations for the use of the funds. It will be very difficult if we are having to monitor and provide technical assistance to the same number of organizations, which I think averages about 20 or 22. It would be easier for us because we're going to have less staffing if, commensurate with that, we had less agencies to be monitoring. But it shouldn't be the overriding factor in your recommendations. It's just another thing to take into consideration.
Yeah, because I'm looking, in fact, some of these groups are probably the best applicants, the best groups coming to us for money. Fair Housing Program, which services hundreds.
Yeah, but we
of
talked about
people.
fair housing. No matter how much they apply, we have to.
Yeah, fair housing,
We have to.
We have to. So that's not going
That's
to
not
be.
going to fall in the
they're one of the
criteria.
exceptions.
Rosie goes to Wall Street's going to fall.
That's essential.
See, you say that's essential. I agree with you, but if we use that criteria,
Well, I
Star's
think-
going to go, Pal's going to go.
Look, let's not look at it emotionally. Sorry, Mr. Shahanian. Let's look at it strictly for bare essentials. What do you need to survive? That's what we got to look at. Because if you're going to give, Rosie goes to
Washington.
Wall Street.
Wall Street. They went from Hollywood to Washington to Wall Street. If you're gonna, give him 5,000 here, and Mr. Moses makes complete sense. 5,000 here and then 2,000 here. They can't use the money in an effective way to benefit the program, and it's cutting away from everybody else that can actually use it. So either we have to take that dramatic step, and maybe I'm coming from a colder place because it's my first year. You guys have been affiliating with these people for 3-4 years. It's much difficult for you guys. I'm looking at it from a 2-month perspective. Hey, what do I need? What does the city really need to survive? What's more important? That's probably why my decisions are maybe a little bit much easier than your decisions are. And I know you guys been going to their sites for the last 3 years, 4 years. It's much more personal to you than it is to me. I'm more looking at it as what does the public need? Public health, public safety, and that's exactly what I'm looking at.
Okay, starting with number 1. So we left. Are we leaving 19,000 up? Can we at least start that and then see how it goes?
Okay.
We're looking at Club Jam. 50,000 is what they're requesting. Last year they were granted 36,000. I think they're doing a great job, and again, they're going to be affected with a 35% cut. I'm not saying let's cut them 35%, but I would suggest 25,000 for now to be put up there.
That sounds fair
Club
to me.
Jam,
Yeah?
Club Jam.
Club Jam 25.
how much they get last year?
They got
36.
36.
So you want to put how much up there?
25 for now. I think we can.
Can you tell me what 35% off of 36 is?
I didn't calculate, but
Yeah, no, I know. Can we
I was-
say
do we wanna-
27?
okay.
27.
Okay, the Zone Salvation Army.
Sorry, that's wrong. You said 25%, it's actually 35%.
Oh, I meant 35. I said
Yeah,
35.
it's actually 23,400.
Oh, so you say I was fine.
Madam Chair,
25,000.
Then let's put
Madam Chair had it
23.
right.
Okay, let's keep it at
23 even?
25 then.
We can come back.
25 for the number.
I'll give it
number.
25 is above the 36. Oh, less than 36%
Okay.
cut.
And they're requesting 50, so they're getting almost
23,000.
50% of it.
22,000.
The Zone Salvation Army, I like to keep it as it is, 15, even though
The zone, let's see what they were getting here.
they got 15 last year.
I'd like to keep them at least to what they got last year. 15?
Yeah.
Second 15. So you don't want to cut their funding at all because
The
they're...
problem is if you
they're
cut
right
it to
down
10,000, I mean, for them to
rooms.
submit and comply with all the paperwork here is really not worth their while, and
All right.
Number 4, Alex, we're on.
I rather take out a program that,
After-school tutoring?
okay, so Glendale Housing, Pat Venture,
Did we agree on number 4?
Not really, but 15 is okay. I agree.
Okay, we'll keep
For
it.
now.
back.
For now, yeah.
Let's just get it complete. Pat Venture, Glendale Housing, we gave them 9,000. I mean, that was pretty low, and I
let's see.
think,
Let me visit that again here.
I don't know, either we
This
give
is-
them more or we eliminate. That's my take.
This is
And
the,
it's a safety net front
Half
line
inches,
program.
I'd like to see them at 10.
I like to see either 20 or nothing. I mean,
Sorry.
can't see nothing, so.
I know, we have to,
Half Ventures.
Path Ventures
Right here.
received $9,500.
why did we do so little
You know, I'm so
last
glad,
year?
Mr. Sinanian, you asked those questions. What are you going to do if you get?
Yeah, I
That's
just
actually
don't
making
see...
a lot of sense right now.
Yeah, how can we, I mean, we're trying to cut $600,000. How are we going up $11,000 on an entity that last year got 9,000? I mean, I would be okay cutting $500 and just going 9,000, but going up 11,000, I just don't see how we're going to do that. That's just unrealistic.
Okay, if we put 9,000, can we count at the end how many small numbers there is, and then just revisit
But you
those
know,
numbers?
also remember that they did okay last year with
9,000,
I know that
yeah.
the only entity cutting them 500 does not hurt me as much as realizing that our staff is going to have to deal with it at the end of the day. But to give them more money, I just don't see how we can do that. We can't do that.
I mean, just because we prioritize, then we're looking at those safety net programs are our priority, so that's
Well,
how
I just don't agree with that. Well, I guess I don't agree with that. I think they should be cut, and starting with a $500 cut is a fair way to go.
Well, the reason I support Mr. Sinanian is they had $500 more last year, and they did fine.
Yeah.
They didn't lose anything. They didn't close down. Everybody, they found the money to do it. So at least what that's telling me is they found the money to do it. They know a path. They know a way to find it. So I don't know. I don't have a
Okay,
problem with.
Can we put 9,000 then?
Yes, sir.
Sir?
Madam Chair, if I may, in the case of Door of Hope and Path Ventures, they do receive supportive housing program funding from the city of Glendale. So the CDBG funding that they got last year, in both cases, it was the first year that they applied for and received CDBG funding. So it was a pretty good year for them. But they do receive other funding sources from the city of Glendale. I don't think they'd be that critically hurt if they didn't receive these small amounts from CDBG, to be perfectly
So
honest.
even if they were cut completely, it would not really.
Affect their program?
I would venture to guess not as much as maybe other programs.
I'm willing to go with that. I'm willing to go zero there because we're being told that they have funding.
I haven't, this is my first thing, so I don't know when these people came on board. That's why it is, thank you for actually pointing that out, sir. If these companies have been surviving for the last 20 years, 25 years without us, our $10,000 plus or minus really will not put them into any kind of critical situation. Yeah,
Okay, let's just put 0 then, for now.
Mr. Cornell?
I'd like to go at this time. It's a critical, and we can come down 500 to 9,000 then.
Okay, well, I think what's on the table right now, 9,000 was at some point, but now we're talking about 0. Based on Mr. Carrillo's representation, that they do get funding, $9,000 this way or that way is not going to impact them in a catastrophic way. So I propose, I'll be the bad guy, 0 up there.
and he was the first supporter of it too.
I was the one fighting. Well, I guess I wanted to.
Well, no, I mean it just makes sense logically. Someone's going to get hurt, someone's not. So it's just let's.
So you're with that consensus on it?
Like I said, I can't. For example, what would you take away? Would you take away the senior?
No.
Would you take that to 0? There's no way you're going to take that to 0 because these people have no other choice but this funding to live on. But if this program's been surviving for 30 years without our $9,000 budget, it's really not going to make any difference whether we give it to them or not. I'd rather add $9,000 to the senior committee. At least give them some kind of hope for tomorrow.
And it may. I don't want to like seem like we're minimizing it. It may make a difference to them, but it's not going to make the type of difference
But
that's
that's
going to
gonna make to that other program.
most of these other entities
That's right.
for whom it's going to cripple them basically.
All right, we're moving forward to
Okay.
So you okay with this?
I'm okay. Let's go to 6.
after-school tutoring. Amendment are at
Let's see here. Where is
There-
Monica here?
we funded 15,000 and they're requesting 34 this year.
I would go for 15 on this.
How much they request last year?
34. I mean, last year,
15,267.
How much they request?
34. So that's
Last year.
Yes.
No, I'm saying.
Oh, last year, how much I
I mean,
requested?
yeah, how much was the request last time around?
I think it's in it's our package.
You have that here. Let's see.
Last time they requested 32.
32, so
33,412.
At 33.
So it's less than half.
All right, I'm okay with 15.
I'm okay with anything.
So we're keeping
I'm
it
always
the
good
same
with
as last
You
children.
year?
okay for 15?
I'm fine with it.
15
Yeah,
then.
15's fine.
Okay, let's put 15 for now. Come back.
Okay, number 7.
And we
Fair
just-
housing.
Number 7, I think we pretty much have consensus on. It's just getting the,
Yeah.
Oh, they have to get at least the same amount, I say.
I agree.
they have to get the
Mr.
same.
Correa?
I think the amount that we were matching with housing funds was $9,000. Since there's been a cut in housing funds, so our share would be $9,000.
So the 7, yes.
Yes,
Much to say.
Madam Chair, this is a case that in order for them to be effective, they would need a minimum of $15,000. In previous years, we were able to leverage what we've been able to allocate with housing funds. Those housing funds are no longer available because of the cuts in redevelopment. So if you could see your way to $15,000.
Oh, we have to. That was smooth.
And it's a HUD requirement.
You can't point the finger at me anymore.
Okay, I guess we'll just put 15 there.
I'm sorry, hold on.
I think we're over budget, aren't we?
What's happening?
I would go for 10.
We can't. We have to
They
put a
don't have
minimum
the funding
15.
to match
I think
it.
we can. Hold on. I think we can. Hold on.
Okay, Madam Chair,
Yes.
I stand corrected. Mr. Correa will give you the update on the leveraged funding source.
Yeah, the remaining housing funds right now is budgeted for about $6,000, so it's $9,000 in
9,000.
CDBG.
Let's put up 9,000.
9,000.
Thank you. I knew we could
And
do
that-
less
yeah.
than 15.
And it's in negotiation here, Mr.
That was good. That was
Okay.
Okay, so CASP,
Number 8.
I'll say for now 20. You can put 20,000. I understand that this is going to affect them, but they're very determined to keep those 2 programs going in 2 different schools, and I think they will manage a way to do fundraising for the 6,000. the remaining balance.
I'm so sorry. I'm going to be your worst. You're going to hate me this week. We got 5 or 6 after-school programs. Let's pick 2 or 3 of the most essential ones that most of the kids attend and get most benefit
This
out
is
of.
not tutoring. This is actually intervention at a young age
I know,
for
but
children with
remember when we went out there?
negative behaviors.
Very true. But it's only 45 minutes, 1 day a week. I do not think it's affecting that much that we assume it's affecting. 4 days, it's 4 hours a month. The kids got 2,000 hours a month of bad behavior from parents and fellow children, and we're giving them $20,000 to give them 4 hours of counseling. I don't think it's going to help them as much as you think it's going to help them.
I say we keep it at 20 because, again, the choice, for some reason we're looking at everything as choice of almost all or nothing, especially with an organization like this where we can cut them pretty close to 3% and still keep them viable. Why not do it? I mean, again, we're just putting numbers up there.
True.
Chances are
We're probably going to have to come back
when
again.
Mr. Hidalgo tallies up the numbers, we're going to be over and we're going to make those painful decisions again. But
Yeah, I mean, the reason that I think they should be funded is just because they're the ones, I mean, the teacher was very passionate about the program, and I think they do see a difference in that few hours, and I just feel like
Well,
the program is
to me,
worth-
like the Home and Men Art program, it's an everyday thing, 2-3 hours a day. Kids can go and tutor. I believe that, and they're teaching at least 200, 300, 400 kids versus 1 day a week, 1 hour a day. It's just more. Let's go through it, and then in the end,
Okay.
we'll tally everything.
What's your recommendation, funding recommendation on this, Alex?
I'm going to go ahead and go with what you guys are going to go with.
it's going zero. I'm
Zero?
saying, actually, Madam Chairman.
Well, my problem is we have how much? 280,000 to play with.
90.
290.
Surprise, we may be able to
You-
manage
yeah,
it.
at the
Let's
end of
just
the
do
day,
it. I mean,
think when we're done, there may still be a shortfall, but it's not going to be as horrible.
Horrible. Okay. Let's go.
I'm
So
comfortable with
long
20.
as we
20?
stay
I'm comfortable with
consistent
20.
cuts.
Okay.
I'm
Iris,
comfortable with 20
can we
at
put
this
20
time.
up? Okay.
Got it.
Okay, let's go to number 9.
Loaves and fishes. Homeless prevention.
It's, number 9 is very difficult. Difficult for me. I'm for holding at the same amount of funding as last year.
How much was that? 42?
Yes,
42,000 that was funded, and according to their presentation, they have a 30% increase. We're giving them 30% less, but since they have the increase in demand, I would say keep it 40.
That's fine.
I mean, if you were to bring it down 35%, they already are experiencing a 30% increase in their demand.
Well, this is one of the ones for this year or next year until the economy starts going. When the people actually need this money, this is one of the ones I would actually say even
I don't foresee
increase.
any changes for the next probably 2 years.
Well, everybody's out of a job and needs food, so this is one of the ones I would actually say put more money into because that's what people are going to use.
Here's the only way we're at the end of the.
Well, no.
There's any,
The only way we're going to be okay is if we don't do that. So I
Yeah,
say
that's fine.
40 is,
That's fine.
under our circumstances, is very generous.
That's fine.
Okay, so those two are eliminated
Okay,
for now.
do we agree on 40 then?
40, yeah, I think so.
Yes.
I think
We're-
That up.
you put up the 40, right? Yeah.
Okay, let's go to number 10.
Hands eliminated, isn't it?
10 is which one?
This is the one, this is the one we,
10
Eliminated.
and 11 have
We
been
deleted?
eliminated.
Yeah. We're at number what?
We're at
number 11.
14.
We deleted also.
It's number 12.
Youth employment. Okay, so this is Glendale Youth Alliance.
Number 12.
We did fund a large amount last year.
I'm sorry, that was number 14, right?
It's number 12.
That's for, this is
one of
this is
those
a tough one.
mainstay groups of CDBG funding. Well,
50 maybe.
yeah, let's give them a good healthy amount. Let's make a cut, but give them a good healthy amount.
50
Can we do the 35% just to start out with? Just what's 35% of 75?
Probably about 40-something, 48, 47, something like that.
Can we do 49,000? Can we do 50,000? How about 50,000? Yes, please.
See, I do not want these organizations to feel like because we have a 35% cut, we're just, then there's no point of the interviews if we were, so I want to bring it back to our attention that based on the value that they provide, we should make the cut either 35% or nothing, or 5%.
I disagree with that. We will never leave this room. I assure you.
I'm not saying being that specific, but overall, there's some organizations that are going to receive maybe 5% cut because of the impact that they're having on the type of work they do and the priority of the service they provide. So, but I'm okay with the 50 on that.
I mean, 50 is still a significant
Yes.
amount.
Okay, so homeless outreach.
Here's the problem. We can't give away what we don't have.
That's right.
We don't have money, period.
Okay, what amount did you mention?
I think 50 is fine for now. Let's just
50?
put,
Which is less than the 35% cut. So we made a lesser of a cut.
Okay, we can come back to that if we,
homeless outreach,
okay.
case management. Okay, so 32 was awarded last year. They're requesting 40, almost
like
44 this year.
I'd like to go with what we gave him last year, at least at this time.
I have to say, again, an important project, but this is part of the PATH family, right? Still, no, it's not.
No, they separated,
Yes.
right? Yep.
Chair Markarian, Committee Member Sanyan, they broke off of the parent or umbrella organization, which was called Path Ventures, and that's why they have a new name, because they're a totally independent nonprofit corporation now. They are the only organization that does homeless street outreach. I mean, they actually have caseworkers combing the streets, meeting with homeless individuals, trying to steer them into the entry point to our homeless continuum of care, which is also the PATH Access Center programs. And so this is truly one of those
Vital.
Safety net, vital.
Safety net. Thank you. That's what I was.
Based on that, I'm comfortable with 30 because there's still a little bit of a cut, but it's not a deep cut at all. Again, you have to consider that the amount that we're dealing with, that everyone is going to take a cut. Everyone has to take a cut.
30
I'm
or-
comfortable with 30.
30 or 10,
Don't
25.
make up, you don't make up $750,000 without making horrible cuts.
But we're definitely not going to do it at 2,000 at a time.
Well, at least 2,000 at a time, as opposed to keeping
Okay.
it the same.
I'm okay with 30 on number 13.
All right, so the next one is Rosie Goes to Wall Street. And I understand that the amount they're requesting is a small number. But looking at the history of this organization, and I mean, not the organization, not the program, they've managed well with this amount. They even have some money back for us. And again, it would be an extra work for $11,000, or $10,000 for the staff to process. But what they do with this money, I think, goes a long way. Some organizations would request $50,000 to do what they're doing. I think they're using the volunteer forces, and they're pretty experienced throughout this few years. They're passionate. I would feel comfortable giving them, again, the $9,000 as they used last year. I know they returned some of the funds, so giving them $8,000 or $9,000, even though this is going to create staff some extra work, but I think what they're doing is phenomenal.
Is this a group that's treated like an outside applicant, or is this somewhat like a city applicant, so you don't have to... it's a city.
City.
So do you subject them to the same oversight and scrutiny? Do you have to expend the same type of resources to monitor them?
Not quite as much.
Okay.
For example, we don't have to execute agreements.
Okay, so it's less of a burden. You know what, again, I want to say don't touch it. It's such a small amount, but again, to be consistent, 9,000. 9,000 is fair. It's the only program for females we have in this city. I don't want to see being jeopardized, and I think anything beyond 9,000 is going to jeopardize it.
It's fair.
Okay, let's put 9,000.
Here, let me get a word out on this one here.
Sure.
I differ with my colleague here. Because these people were efficient, they're good money management handlers. They did an excellent program and allocating the funds and managing it well. And we allocated part of those programs to a needy organization. Now we're penalizing for that. I say no. I feel give them at least the amount of $11,000.
Mr. Cornell, my only objection to that would be they returned $2,000 last year. Was it 2 or 4? No, 2.
Two.
2. So I think they managed okay with 8 or 9,000, and we don't want to go through the same process because the year before they also returned something. So I think we are receiving, some unspent money back.
Just a quick question, why did they return that money? Just remind me. I don't remember.
I think they just.
Yeah, Madam Chair, members of the committee, they had actually some personnel costs which they're saving, so they didn't spend the amount of staff time they needed for some outreach or some other activities, so they didn't use up the
comfortable with a 9?
I would like to go for 10 then, if that's the case.
Okay, let's put 10 up there now.
I like 10 better than 9. But
Okay, let's go to number 15.
Then we just go over there?
I think we did
You had previously
allocate
decided.
10,000 to the PAL program.
Let's see what it was last year here.
Training group, that was a good program, I think, students
Gave them
training.
13 last year, so 30% cut on that. That's 10. Not convinced that.
I'd rather take the boxing program out, put 5,000 on top of their 13 and make more kids get, because they're doing actual one-on-one police and one-on-one
Interactions.
interaction with the youth.
are we on the PAL?
No, we're on right after
Star.
Oh, we're on STAR. So what happened to PAL? I know we made
We're on
some.
15.
We left
Put
10.
Oh, we did, okay.
We're on
sorry.
15.
Sorry, yeah, you're right. So STAR.
Can we change the requested amount for STAR to 26? That the
Yeah,
the
what they
corrected
actually
amount.
request is 26,891.
No, the requested next year. 1213 needs to be changed from 15.
Sorry.
Yeah.
You want to go to 16?
What was the amount on here?
No.
I think
Yeah, this is a city program, so the administrative aspect
Okay,
of it is not that costly. Am I correct on that?
16?
So I'm more like thinking more like 13.
yeah, but what was the requested amount? I think we fixed it.
26,891. Last year they requested 19,000, and we allocated 16 to 21. This year they're asking for almost $7,000 more.
Well, remember, this is the one the police officers put out of pocket.
Yes, and at least my feeling of the amount of commitment from the police was incredible.
Yeah. What I was suggesting is, if one of these programs is not going to be as efficient, I'd rather take that money and increase theirs to 20,000.
Increase? I mean,
Yeah, I know exactly what you're saying.
Okay.
Alex, let's put a 10 down fund
Yeah,
right
just
now.
whatever,
and
and
then
then go
we can
through
come
it.
back to it. I'd like to go for 15.
I agree.
put 15 and then we'll deal with it.
And what about number 15? Did we get a consensus on that?
I think we put how much we put up there? 15?
10.
Oh, 10. 10 we put up.
10?
The Armenian Relief Society are moving to the next one.
Number 17?
Yes. They're requesting 58, and that was strictly for a salary of that one person.
Oh no, they're requesting 89.
I'm sorry, they're requesting 89. We funded 58.
17.
I would be okay with 30.
I would be okay with 35% less than 50. That would be okay. Because I don't, unless someone makes a compelling reason why we should cut their funding any more than
35%.
35%.
They have 58, what?
How much?
They have 58,205.
Media outreach.
It's going to be right around 34.
38,000.
Yeah,
around there.
38,000.
We put 35. I mean, it's just because it's such a large number. And do we have...
And they provide the services for it.
But remember, we have some new
I say we be fair. We're being much more unfair to them than to others, because others we didn't cut 35%. I'm saying let's cut 35, put the number up there, and then if we have to come back, we'll come back.
Okay, so what was that, 38?
38,000.
Okay, let's put that
38?
up.
Yes.
Okay. Let's see, number 18.
Okay, so Glendale Associates, where are we?
Yeah.
And Association for the
Gar.
Retarded, yeah.
Gar.
This one, boy, how do you touch this?
Just
How
like,
much did they get last year?
just like the others.
9,542.
I think just keeping it at that would be. Either you got to keep it at that or get rid of it completely.
No, we're not getting rid of it.
Can't get rid of it, so you just.
I will not agree to that.
I'm against that.
That's what I'm saying. Either you got to get rid of it or keep it at that. So keep it at that. It can't get any lower than 9,500, is it?
Okay, let's put 9,000
But
for
at least
now.
I think Mr. Carrillo and Mr. Duran are going to be very uncomfortable, even with 9,500. But I agree with you.
I mean, it's not going to get cut and it's not going any lower. So
I'd like to keep it at what we funded last year. What did you say, Alex? How much?
I said it's not going to get cut and it's not going to get any lower than 9,500. So either keep it at that or
I'd like to keep it at the same as last year,
I'm okay
95
with
then.
okay with that. Actually, put 10 just to have.
Yeah,
a nice
just round it up
number.
to 10.
Okay,
Please.
10.
Okay, so Senior Services
Okay.
Program.
Let's see here. Number 19,
Senior Services Program,
let's see what they're asking here.
they are asking 66,600.
Okay, can I
Yes.
19.
Can I go? Now, I was the guy who said that our additional money that came back this year should go to them, right? I was the one who first.
We all heard
So,
that.
You all heard that. So now I'm going to go back to my usual self. I'm going to say this is a fantastic program, serves a very important need, but it's in essence it's a city program. They're coming at it they're taking second crack at this. So with that in mind,
How much did you give them last?
last year we gave them 20,992. This year,
I say 15 is fine.
I save 15 to start out.
I wouldn't go lower than 20, you guys.
Why not?
This is,
Yes, sir.
Well,
oh, wait a minute, I'm sorry, I'm
Put
talking.
5 in there. You know?
we just put more money in it. I know it's a different year, but nevertheless, we did wholeheartedly agree to allocate them 5,000 in new money.
You want to go 15?
I think
I'm against
Mr.
it.
Duran?
Madam Chair, if I may ask a question. Committee Member Sinanian, when you refer to a second crack, what are you
I
referring
mean,
to?
you know how the CDBG funds come and they become pre-designated. The city decides. Doesn't the city decide where the money is going to? Because the actual amount that comes from HUD
Not this
and what
one.
we end up in terms of allocating.
Yes, the only pre-designated city projects are for capital improvement projects, not
Oh,
not
no.
social services.
Yeah, and I think what the way they explained it, some of their funding
Thank you for
comes
that.
from California, state of California, or LA County. They said for the food and all that, but
So I apologize for that comment. That obviously is a result of me not understanding the process well.
but to me,
But I'll
keeping
go-
it at the
but-
20,000.
You'll keep it at last
I
year's
say,
funding.
but it's still a city program. The city usually finds sources to fund its programs. I know they're in a jam. We're in a jam. Everyone's in a jam. We have the general fund. We have the reserves. I hate dipping in it, but important purposes deserve that kind of a treatment. So the city, I think, can cover that $5,000. That's all I'm saying. So I'm saying 15. And
Mr.
again,
Correa.
let's put it up there. If we have extra money, we should go to this as number one.
Let's,
Mr.
Madam
Correa.
Chair, members,
before we put it up there, let's have a discussion on it here. I completely disagree with my colleague here. It's too vital program. It's a safety net for seniors. We heard from the speaker here that the frail and involved seniors are increasing. We just can't leave it, reduce it. It's really painful to leave it as it is, but it's also, in the other spectrum, it's difficult to increase it, but I couldn't go any lower than 20,000 on this.
And my retort to that is, we're cutting funds from CDBG funds. That doesn't automatically translate into the service being eliminated because it is a city program. Now, I know I'm making an assumption there, but I think I'm making a safe assumption. Yes, Mr. Duran.
Madam Chair, committee members, as the director of the department under which this program is being administered, for the current year, we did cut $1.2 million from our general fund budget. Included in those cuts were cuts to our senior care program and our youth and family services program. I anticipate that we will be asked to make more cuts again for fiscal year 12-13, and it would be virtually impossible to be able to supplement the CDBG funds with general funds, knowing that we're facing additional cuts. Unfortunately, human service programs are easier targets than closing down community centers or closing down Pacific Pool, for example, or not mowing the lawns in the park or blowing the leaves. And that's just the reality. I don't think we can assume that if we're not able to use CDBG funds for these programs, that they will be funded anyway.
Mr. Correa.
Yeah, Madam Chair, members of the committee, just again, regardless whether it's a city program or a nonprofit community program, just again, looking at the priorities, looking at the HUD guidelines for us that, of course, seniors are, and this, I guess I heard the at-risk seniors and the frail seniors are one of the highest priorities, certainly, of our planning, our documents. And again, regardless whether it's a nonprofit or a city program, it is the only senior program that's on the CDBG list, and really one of the most viable ones in the community. So that would take very significant, any cut would really significantly impact the services provided to seniors. But again, that's more of the priorities of what HUD is and the city has been given as far as those kind of services.
All right, thank you, Mr. Correa. So I think maybe we can start with the 20,000, if that's okay for now.
That 20 is
Let's
okay.
just put the,
under circumstances.
20,000?
Yes.
Are we-
and move to the next one, Youth and Family Services Program.
Number 20?
Yes.
We got to get rid of one of these after programs, or two of these after school programs. There's 5 or 6 on there. If you try to fund every one of them $15,000-$20,000, it's just going to be after school programs and senior citizens program. That's it. You'd be done. So you either got to vote which one's the most essential and get it, because everything I'm looking at, it's either after school program, drug prevention program, police prevention program. It's some kind of an after school program.
But again, we have to keep in mind, those are the safety net program, the priority for the city. I do not want to see, repeated programs up there as well, but we also have to consider that it is, the frontline safety net program, the senior care services and youth at-risk youth programs. Mr. Correa, if I'm not mistaken, this is also a city program, correct?
Correct, yes.
Right.
Anything with the parks, yeah.
Right. So we funded, last year they were funded 15,267. So if we fund less than what we funded last year, would this still be a vital amount? Would this still be a program that can benefit from that small amount? Or should we altogether not fund it? I'm just very confused when it comes to small numbers and the time and effort involved in doing all the paperwork from both ends, the city and the applicant. So that's my only.
The Parks and Recs program, too. It's our same department.
It would be, as far as the city goes, there would be less paperwork involved.
Yeah.
Funded at 15, and come back to that, and see how much we are over, and then reckon with it.
Yeah, but
I'll say 10 and then come back over, or 12 and
We're
come
already
back.
almost 100,000 over.
We are over 100?
100,000?
I'm not
49, isn't it?
Currently, the deficit is 49,000, but
49.
you haven't made a determination for
A
two
few more.
programs.
What's this
Two
40?
projects.
How much are we over, Iris?
49,000.
Oh, 49.
49,000.
Hey, we funded somebody 50, right? Just take that out and we'll be right there.
We haven't tackled the last one yet here, have we?
We got two more.
Number 20?
Can,
Have two
can I
more.
ask staff
Oh, yes.
a question on this? Madam Chair, I'm going to
Yes, I'm sorry. Go ahead.
Is there a horrible explanation of how this is going to get canceled at the program?
Chairman,
Not being cynical at all. I mean,
Madam Chair, committee members, what this would amount to, we're using the CDBG funds to fund an hourly, what we call community services specialist position. And she provides support to Walter, and Walter provides support and receives referrals from different agencies to work with youth and their families. Without the CDBG funds, we would not be able to maintain that hourly position. The program will probably continue at some level, and Walter would continue to do his best. Without that help, it wouldn't be the end of the world. I don't think it would be as devastating as a reduction to the senior care management program, for example. And if we had to choose, I think the senior care would be the higher priority right now.
okay.
I don't feel personally, take a look at the council and their priorities and how they look at the city projects and their budget outlook for this year. It's not going to be any better than it was last year, what they had to, and they were pretty much in a financial straitjacket, and pretty much it's going to be comparable the same this year. I'm against eliminating that. It's a vital program. We have to keep it at some funding because it is a vital program. And I'm quite sure the city council, if we were to cut it, that they would restore it somehow. So I'm against cutting it. I'd rather cut the recommendation that we had for 17,000 for number 22 than to cut this program.
We had 15,000 for number 22.
Yeah, that was 15,000. But I don't know. Does anyone have thoughts on this? Tired of putting my neck out.
I mean, I'm just looking at this program, and again, it will continue the youth program. It will continue, and maybe for this year we can try not funding it, and if they want to come back next year, because this is part of the city program, I'm sure they will come back next year, and then we can examine, we can see how well they did without the assistance of that one person, and if we need to re-examine it next year, I'm willing to do that. But maybe this year we can take off. I mean, we have to eliminate one way or another. I think we are supporting enough city programs here. So if by eliminating that one, I think we're just, giving the opportunity to the others to prove themselves and come back next year. We want to see different programs. We want to help organizations that that they are doing well, good in the community as well. It's just not because they've been there many, many years. It's just not an automatic funding. That's not how it should be. So,
Just again, Madam Chair, just a reminder again, this was one of those that we looked at as far as safety net program for youth. It's more at-risk, high-risk youth. I know there's some other ones that, well, I'm sure you'll look at the list.
right. And I'm saying that
Yeah.
will continue. I would hate to see that program go away. Obviously, that's not the case. But I'm just saying 15,000, if we fund it, it will be to a level of 10,000. And is this a significant amount for that program? I mean, that's my question. Can we bring this back next year and see how they did without the $10,000?
I think the 11,000 would suffice, and then we can see with staff how they're making any changes and working that. That is,
Why don't we do? I mean, why don't we just put 10,000 there for right now for 2 seconds? I mean, literally 2 seconds. And then, would everybody agree we should get rid of ARC at least?
Yeah, I agree.
Yeah.
I
So get
think,
rid of ARC.
You mean on number 23, Alex?
21, I believe.
no, it's
Oh, 20.
23. I mean,
23, sorry.
It's number 21.
21, right? 'Cause
Yes.
there's only 22 agendas.
I know, I'm seeing 3, but
Oh,
yeah, that's a
21.
different.
Oh, that's what we're discussing now, then. So you recommended what?
ARC?
11,000?
He wants to eliminate.
No. The one we were talking about, the city program, the Parks program, let's keep it at 10, 11,000, whatever Moses wanted.
Yes.
And let's get rid of ARC completely, so at least we don't have to talk.
You mean ARC? You mean Holmington? Is that what you're referring to?
ARC, number
Our
20.
Family Center, the
21.
next one.
Oh, which number, Alex? You're-
Number 21. Eliminate number 21 and give number 20 about $10,000 for right now. Does that sound fair?
I want to ask a question about the communities, the youth and family services. $5,000 be just a waste of your resources because you spend more in managing the program? The actual amount? Would that
So-
be ridiculous? Yeah. Okay. 10. Just put 10 up
Just
there.
put
and
10
then
out there.
if we have to eliminate it, we'll eliminate. I mean, we won't be eliminating because, as Mr. Durant said, it'll probably continue on even without this funding. But let's put 10 up there. And I guess that's
10 is
the la-
already up there.
Yeah, it is. And what's the blank space there?
I think that's the
ARC.
ARC, the
The youth
So
seminar.
youth seminar.
there's a proposal to put 0 there. I hate, again, I hate
no.
eliminating anything, especially that when it's after-school program for kids. But I agree with Alex that there are already several after-school programs. All things considered. Yeah, I mean, I
Well,
agree
you know,
with
it
that.
is a great program, and I see that, you know, it's working well year after year. They're back, and again, there are programs like that already existing in, you know, on the board. I'm seeing similar programs. And it's already at 11,000, so going any lower would not really make sense. It's just, what would the impact of $5,000 on this organization?
Well,
And
what's 35% from it then?
right. So I'm okay with eliminating it this year. I mean, again, not every organization will receive the funding every year, year after year. It's not like a guaranteed number that every year you would receive this, especially that we have such a large cut, 35%. So, you know, it is just given that some of these organizations have to do their own fundraisings and become more creative for the upcoming year, and then the year after, they can always apply, and then we always re-examine. So I'm okay with eliminating that right now.
Okay, so
I'm against it. I'm against it. You know, this program's been around quite some time. They have a good track record as far as measurable results. I can reduce it, but I feel very uncomfortable due to the success of the program in scratching it.
Okay, then we have to, if we keep the, let's say, the number to 10,000, then we have to go back and look at some of these organizations and do the reduction with them. I mean, we already have $60,000 over, so we have to cut it from
Well, I'd like
somewhere.
to eliminate number 22. We have 22 here. And I don't feel, and this is a new program. And it's a Johnny-come-lately program. It is a sensitive to the community, but we have duplicate services here that provide this service. And also, at this time, they did not complete and they did not make a pre-bid conference on this. So I feel this should be, if we're eliminating others, that this one should be eliminated.
you know what? The only reason I don't want to eliminate that, Mr. Cornell, and I'm thinking about it from a complete different point of view, perspective. when he was talking, 1,500 to 2,000 people that can't afford Medicare or Medi-Cal or go to a hospital can go there, get a free checkup on that day. Those 90% of those people are going to be senior citizens that do not moved here from a different country, that can't afford to go to a doctor, can take advantage of that one day and go there and get at least a physical. That's what the only thing pushing me to keep something like that going is to, for example, let me put it to you this way. 2 years ago, I didn't have dental. I couldn't get my front teeth fixed. Because I couldn't spend $8,200 to cap my front tooth. So I had to sit there and rub it down with rubbing alcohol and Tylenol all day long to numb the pain. And that's me. I'm thinking about what are other people doing that can't afford to get any kind of assistance, medical assistance. That's the only thing. When it comes to health and wealth, it's a top priority. If you can't get yourself checked out because you can't afford to get checked out, and if you can't get some food because you're too old and not working and you don't have $2.50 to get some food, then there's no reason for this committee to even exist. What are we trying to vote on?
Okay, so can we, for now, put 10,000 for the ARC, and let's see what the...
Okay. What are we over now, Iris?
With allocating $10,000 to ARC Family Center, we are $69,000 in deficit.
Okay, so can we go back all the way up?
To the top?
To the top.
16,000, you said?
69,000, almost 70,000.
6,900.
This is a problem.
Okay.
Square one.
Okay, can we go to home element? What did we do? 15, we kept it 15. Can we do that one 10?
You know what, I gotta say, it's already such a small amount considering the amount of work that they do. Again, home management going from 15 to 10, it's almost like eliminating the program. For them, the impact is going to be the same as eliminating it.
I don't see eliminating home management because that's the only program I was reading through that's helping.
But we're
at
not
least-
talking about eliminating, but even going
No, going down.
from 15
Going
to
down,
10,
yeah.
I think it's tantamount to...
Yeah, because they're the only ones helping out at least 150 students and on an every daily basis.
Daily basis.
Daily basis. I can get rid of one of those programs that's 1 hour a week because chances of it affecting.
Clarification, it's only, they're only serving 60 students. It's they used to have the bigger program, but this is only 60.
60 kids per year.
Yeah, yeah.
I mean, still, it's on a daily
Yeah.
basis.
No, unduplicate throughout the year. They're only there part-time. It's not a full-time tutoring program. I understand. It's 60 throughout the year, unduplicated.
I thought they were there 5 days a week, 3 to 5, something like that.
Check
Not
their-
for this program, I guess, but...
Okay,
Yes.
whatever.
Yeah, we're
I mean, just to
funding.
be fair,
we're
because-
funding a specific component of their larger program.
Organization.
whole
I
thing
got
is
you.
just that one specific program.
Okay.
We have
I honestly, I think it's more important than ARC is, to be honest, if not to single someone out, but
Alright.
whatever decision we make from this point on is going to be excruciating. So
I don't think we should have unanimous decisions now at this point. I mean, it's just a majority. I mean, I would love to have unanimous decisions, but if it comes to a point that we have to argue, and
this will be the first year in 4
30
years.
minutes.
4 years that we don't end up having a unanimous recommendation.
Okay, how about youth employment program? Can we do that? Can we go to that?
Number is that?
That's number 14, I think. No.
Sorry, what is the name of the program you're in?
Youth employment, number 12. The Glendale Youth Alliance.
What number is that?
Number 12.
How much was that we gave them?
Currently, we have $50,000 allocated.
I don't think it's fair to even reduce anything from there, to be honest with you. 'Cause you're going to cut them over 40%.
I have to ask staff to remind us what are their sources of funding other than CDBG?
They receive CDBG funding they usually receive funding from a county, CalWORKs funding, to hire low-income, very low-income youth during the summer. They have a self-sustaining component where they get their own private contracts and do work and hire youth that way. They will receive from time to time like some smaller United Way grants. And I don't know if Karina mentioned it in the presentation today, but generally speaking, every $1,000 equals one youth that either is or isn't able to be hired. They typically serve anywhere between 300 to 400 youth. At any given time on their waiting list, they have 1,000 eligible low-income youth. This is one of the City Council's expressed highest priorities as it relates to the CDBG program. So.
Yeah, but that's 25%. 50,000 is what percentage of 290 is it? Is it 20% almost of the entire fund going to one organization?
No, about 17%.
17%.
Yeah, but you can't take $80,000 last year funding and bring it to 40. You'll be cutting. They're only
Are we taking eliminating?
we're
bunch of
eliminating
programs?
organizations.
Well, you can on this particular programs because they're only using 32% of our money for their overall use.
Can I ask another question of the staff, Madam Chair? So if we, let's say, cut a little more from this, I'm asking for your professional opinion based on prior experience. Do you think the council is going to simply reverse our decision and then it's going to get messy? We have to somehow figure out a new configuration for the numbers, or do you think they'll just come up with the money? And I know you can't give any guarantees. It's just going to be based on experience.
In my opinion, based on my experience with the CDBG program and the council, they may very likely revisit this recommendation.
That would mean us having to reallocate the whole thing.
Don't waste your time now then.
We've cut. Have we cut the 36%?
You cut-
I don't think they can blame us for that. But have we cut beyond 36%? Because they're asking this year as much as they asked last year. We gave them 75.
It's 48, I think. It comes down 35%. Translates to 48,000. So,
Can we put up 48?
Right, is
Are
it?
you okay with that?
am I correct?
Is it?
I guess it's 35%. It's not 30. Say 36%.
6,000,
I think you said 35.
Okay.
49,000. 50, again, that's
this-
already
That's the
30,000,
match?
yes.
I say don't touch it.
It's currently
I say
at 35.
let's move on.
And the thing about that is at least it's a rationale. The rationale is it's consistent with the cut we got from
I
HUD.
agree. I think
35.
that we can sell to the city council. Otherwise, we're risking.
Yes.
I mean, remember, all we're making is a recommendation to the
That's
city
it.
council. They're not bound by our decision.
Okay, how about homeless outreach? 32. We're at,
Homeless
keeping
out-
it 30. So can we do 35% cut on that one as well? And see what the numbers.
Which number?
Your program
Number
won't work.
13.
13?
Madam
Yes,
Chair,
Mr.
again, I'll probably repeat this 100
No,
times.
no.
It's
Enough.
really the importance is to, I know we have 35% cuts, and I think Mr. Sinanian has said this a number of times too, is I think we have to really look at eliminating programs versus cutting programs so bad, because again, if you look at what last year was cut, 15%, and it's been down, most of these have been down like 25% over the last 2 years. And in my opinion, and I'm sure staff would say that we cut them too low, it just really hurts them more so with all the administrative capacity. This pays for a staff person basically to be out and
That's-
homeless outreach and
That's
veteran
actually,
and
that's
so
the
on.
only homeless.
So these
prevention.
are, again, we're not looking at, this is the minimum that they could run, really, essentially,
How much is up there? I can't see.
30,000.
Mr. Correa, we're short 60,000, and we don't want to touch any of these organizations.
Okay.
Well, again, Madam Chair, I know that's the most difficult
This is
decision you
very
have.
difficult.
It has to be cuts of programs.
No, I totally
It's
agree
beginning
with
to
you.
shrink
I agree
1,000
with
here,
you.
2,000
But
there.
most of our, most of the organizations up there are frontline, and they are safety net. I don't see any that isn't.
Get rid of the
Tutoring may
bouncing
not be safety
program.
net.
Except
Except the tutoring.
I don't know if that's a safety net or
except for
not.
22.
What's
For
20?
22.
22 is that the medical
Oh,
festival.
hold on. Is the boxing thing still up there?
Can we take that one out?
we take
I
boxing out?
just want, because there's no way we can.
Al was currently at 10. You would like to leave it at 0?
Yes.
The tutoring, what's the tutoring? I'm sorry.
There's ARC, there's
How about the library? We took that, okay?
Took
The
that out.
mobile.
Sorry, you wanted to look at the library? That one was
That was
taken
done
out.
already, okay.
Yes.
Can we go
Are
down?
we okay? Are we down?
Iris, what is the amount that we have that we decided on for item number 22?
The deficit is $59,000. We've only eliminated 10 since,
We ordered 10,000 on that?
Yes, Mr.
Madam Chair, there might be some merit to taking the approach that's been suggested by Committee Member Oganessian, and that is to take groupings of similar programs, for example, all of the youth after-school or youth counseling programs, and maybe prioritize within that category and fund a project or two where we can get the most bang for our dollar. And I know those are very difficult decisions, but that may be the only way to whittle this down and be left with programs that will be effective, rather programs that will be left half
Okay,
effective.
So in that case, let's look at the after-school programs. We have the Salvation Army. We have this Club Jam, so that's 2 after school. We have Homenmen Ararat. We have CASPS. It's not after school, but it's still, school and behavioral intervention at risk kids. So 4, we have STAR, 5. So we have 5 after-school programs. Can we go down? Is there any more?
ARC.
Okay.
ARC.
And then we have ARC. So 6. So 6 out of 22.
And do we still have Rosie, or did we eliminate
And
her?
Rosie.
And Rosie.
Rosie's
Yeah, but
not an after
those are
school.
programs, for example, Rosie and ARC, where there's a lot of cross referrals, where in many cases they're serving the same young women, which normally is very positive and it's good. We want the organizations to be coordinating services, but again, we've got to pare this down.
Yeah. So do we agree to eliminate some of those? I mean, you were suggesting to take out CASP.
I say keep the one that most kids attend, and that's something that's available on a daily basis. That's the only thing. Now,
So
whether
it's between CASP, ARC.
what's Rosie? Is it a daily basis? No.
It's a summer program for
Get rid of
6
Rosie.
weeks or so.
You're not going to get my vote on Rosie.
Not mine either.
Okay, CASP.
Trust me, I don't know any one of these programs, one better for the other. I'm just trying to make most logic for the money. Whichever one you guys want to cut, doesn't matter.
ARC, CASPs,
I st-
amendment. We have so many that you really have to start.
ARC,
I-
ARC and JAM and
The zone.
I would keep the jam. I would
Them I would
probably
definitely keep.
get rid of, but we're saying eliminating that really, when the organizations watch the deliberation, I want them to know that they should come back next year. It's just this year is so tough, and maybe next year, it may get better, or,
It may be worse.
it may be worse, but definitely they can try, and we would try to revisit, and it doesn't mean that because they're not funded this year, they should not apply next year, or they would not be, funded next year. It's just, there's no other way to handle this.
Well, there is. There is. Here we're looking at trying to cut or eliminate well-rounded funds, resources that have a proven record of higher expectations. And here we have which I
respectfully disagree with Alex on, and we're funding a new program, and we can't even, and now we want to eliminate existing proven records of funds that have proven records. And that's where I draw the line.
Right, I'm not going to comment on that specific program, but generally speaking, when it comes to any new program, for the past few years that I've been on this committee, we have repeatedly funded the same program. So we're setting a precedence out there that if you're a new program, do not even come forward because, you are not going to be qualified. Even programs with success records, years of success records, just because they're new programs.
And Madam Chair, it's possible that after this year, we may very well be doing that moving forward. Because our current funding level, which is down to an entitlement of, I think, $1.9 million, that's our new base year. I don't anticipate that it's going to be any higher than that in the next several years. It's possible that we may begin to get some feedback or some direction from City Council to modify this process here, and some of it might be maybe beginning to pre-designate even social services, maybe direction where rather than wasting organizations' times, continue to fund existing programs with continued demonstrated effectiveness, meeting the highest community needs and serving the greatest numbers, and don't waste any time on anything else. But that would be moving forward. And those are things that we should consider, either if it's between staff and the council or between staff and the committee or a combination. And it may very well come down to that. But for the current year, there's still the opportunity to squeeze in a new program. And by eliminating that program isn't going to solve our problem. Again, I think we have to go back to see if within the clusters, prioritize within the clusters. And rather than giving 10,000 to 3 organizations that are doing very similar or serving the same target populations, make that investment in 1 or 2 core organizations.
All right, so can we go back to some of those organizations, similar programs? So we're looking at
Can you read off the numbers?
ARC, CASPs.
Would you like me to read them off?
If you can.
I will read them off. I believe it's Club Jam, The Zone, after-school program, after-school tutoring, home and admin, the intervention CASP, Rosie Goes to Wall Street, STAR program, and ARC Family Center.
Of those, I think, again, I'm rejected right now. But ARC is the one that I wrote on.
Well, sorry, ARC and these are all about the same age group? Are they all serving the same age group? They're all the same?
ARC is serving
Rosie, ARC, I know, are serving teens.
Teenagers.
The teen program is serving, obviously, teens. I mean, if you're going to keep 2 or 3 programs, at least keep it one for the teenagers, one for the
Yes.
preschoolers, and one for the middle schoolers. So at least we have one program for each.
so Club Jam would be one
Club Jam, I suggest we keep.
we keep.
We want to keep Rosie.
We'll keep Rosie, Club Jam,
But hold on.
and Home Element. Any other?
What was the question, Twyman?
I mean, we're keeping one category. I mean, we're keeping one organization from these categories.
We're keeping one out of the whole category?
No. One from different age groups. After-school programs. So Club Jam is more elementary.
Can we do this? Can we take Rosie out of this category because it's not truly part of that category? Because it's very specific. It's gender specific. Separate. The amount of money we're allocating to them is already paltry.
Okay, I
we
agree
just
with
put-
that. Take
set it
Rosie
aside?
out of the picture. That's fine. Let's-
Okay, I concur, because I can never vote against Rosie.
Okay. Now let's look at the rest of them. So what's the what's the logic?
What's the rest now? What?
I prefer to take ARC out and leave Rosie.
I think the two have nothing to do with each other. I'm saying it's unfair to put Rosie in that category. I think Rosie should be left up there as is, and then we look at the rest
I
of them.
see what
and
you're saying.
think,
I thought you want to eliminate Rosie.
no.
okay,
I'm saying don't even think of Rosie as one
I
of the
see,
one of the
okay.
groups to be eliminated. No, please.
Okay.
And then of those, I think ARC is the most natural one to go first. At least first.
Can I ask?
I don't even think taking ARC out really solves our problem.
I mean, we're
Can I ask a
60,000
question?
behind
How much? 60?
budget,
60?
so that means taking at least
60.
three.
Can I ask a question? I mean, we got to face this a little bit realistic. Going back to number 22, the Armenian American Medical Society, they need 50, right? I believe 48.
47.
Only 17,000 is
That we
eligible.
know, but they need 50, right?
That's what they asked.
And we're bringing them down to 10. Is it really helping the situation?
We
Are
took
we
them down
just-
to 15.
15. Is it really? Are we doing anything good, realistically?
To be honest, I don't know the organization. It hasn't been.
Speak into the mic, please.
It hasn't been in front of CDBG before, so I personally have difficulty answering. Obviously, it's a very
great
good
cause
organization, great cause. But you're asking a question I can't answer.
We're facing reality here. Are we helping the? Are we helping them in any way by doing 10 or 15?
I think the only one who could answer that question potentially would be our Madam Chairman, but she can't comment on it, unfortunately.
I mean, I'm not going to comment on that, but
yes, Mr. Carrillo.
Just to comment again on the Health Festival, and I know that's one of the comments we made was they're going to need a lot of assistance with their income eligibility. That's the biggest CDBG question is they have to collect $1,500, which has never been done in any of the agencies, and 150 persons walking in with W-2s, and we know that's a challenge. I hope that doesn't constrain them from servicing 1,500, and now they could only serve 750 because it's so tight with CDBG requirements. So just a little red flag on that one. We did put a condition on that they would not get the money until they show that they're actually able to provide the income verification for this program. Certainly, I think we would work with them through this year over at Pacific when they're doing their program and assist them with maybe getting a kind of sample this year and see how that would work without constraining the program, and that's the committee's desire, and see how they're able
Looks
to
like
do
there's
that.
more obstacles than positive things in the
Well, there's
ways.
challenges. It's a great program, we know, because it's run out of one of our community centers in South Glendale. My only concern is with HUD. HUD is really, now with reduced funding, really narrowing down for the cities to really make an effort to document very carefully their low-income population, especially with congressional oversight. And if we make any mistakes, I just don't want to be the person to report to council that we couldn't spend money or we were caught with this situation. But again, we're willing to work with them and assess their capability of doing the income verifications, looking at what population is Glendale and what population is seniors and youth. I think it's a very important project, and it's.
You're saying you work with them even if they didn't get funded?
Yes, we would. I don't think we would give funding, but we would want to work with them and
Time them for next year.
Yes, we would provide that technical assistance to them so that we can see, engage them. Again, staff could be out there that day. We can see how their eligibility. We can check with HUD and all those questions about some of those costs not being eligible. But it's just a little bit of red flag. And
Can we take that 1 hour after school, not after school, the during school program out real quick? I think we're giving them 20,000. Am I correct?
I'm sorry, which program is that?
I believe it was not the CASP. Yes, can we take CASP out for a second, please? Does at least some people agree to a point that we should get rid of CASP at least?
I don't agree that CASP, I mean, if we're going to get rid of something, at least...
Which one would you say?
I think we may end up having to eliminate CASP, but that doesn't, it's not the one that comes to mind as the first candidate. I think ARC is a better candidate for that.
I think it should.
Be honest
It's
with
going
you.
to end up maybe both.
And I
60,000.
recognize that, and I'm agreeing with that. I'm saying possibly we may have
Can you
to
do this real quick? bear with me for 2 seconds, and if you wouldn't mind, can you get rid of ARC, CASP, and Glendale Health Festival? Just for 2 seconds.
We would have a deficit of 14,000.
We still would be under? We'd still
We
be
would
under?
still have a deficit.
So we're only short 14, though. I mean, that is very close.
1,400?
14,000.
Oh, 14.
The ratio was 1,400.
That's eliminating CAS, ARC, and the Health Festival.
Okay.
I mean, yeah.
I can't really see the chart. Would you mind if I went over there? Oh, no.
Please.
I can't see how much we put
What
in.
about 22?
I brought my glasses. I can't see.
You can also use the mic on the podium if you want. You can take it if you'd like to speak. Could even take it with you if you'd like.
Yeah, it should be on.
Okay, how about
Yeah, we can hear you. Be honest, I can't see anything. Someone would have to read out the remaining entities.
Can you point out the number, Alex? It's easy to read the number.
I think the battery's down.
Okay, let me get you another mic.
Well, number one, okay, we got, what we're funding right now, we got homeless women and children. Transition housing program.
Alex, we have to get you on.
Can we go through them and ask staff to say frontline, not frontline?
Sure.
I don't know that it's going to help, but let's try that. Can we go down the list?
So, the first one is homeless women and children. That's certainly a frontline.
Yes.
Okay, forget about
housing. Club Jam is, we think it's a very supportive program because it's provide after-school daycare, really,
Okay.
for especially working families. The Zone is another one that is after-school tutoring for home enactment. Actually, I made a mistake. It is a Monday to Thursday program, 1 hour a week during the school year.
Okay.
That is, I guess it's kind of gray where you would say it's a safety net. Tutoring is, as we mentioned before, is something that's offered in the Glendale Unified School District and by Club Jam, Salvation Army, Youth and Family, so it is a service that's out there. But, of course, as Armand said, there's never enough services for tutoring, but I don't believe it's a safety net program. Fair housing is a requirement.
We get them, yeah.
CASP is not a safety net per se, although it's very close, I would say.
CASP,
CASP.
we've taken it off the list.
Okay.
So
Loaves and Fishes is a safety net. Youth employment is a safety net. Homeless outreach is a safety net. Rosie Goes to Wall Street. That's a little bit gray. That's at-risk teens, and it does provide some limited case management and some referrals to other agencies, but it's not a per se safety net. STAR, that's again another gray area. That's working one-on-one with some kids, and
how much
those are
is
high
STAR?
risk.
How much are we funded STAR?
15,000.
and
That's
they
a cut
and
from-
we funded 16 last year, so we're almost keeping it.
And STAR, you said is gray.
Yeah, I think it would qualify as a safety net. Yeah.
Can we keep going then?
Community outreach is Armenian Relief Society, certainly a safety net program, and that's a pretty significant cut for them. They do provide a great service in the community. ESL, that is not necessarily a safety net program. It's certainly a supportive program.
Is that the GAR program?
GAR, yeah.
Yes.
I don't think we can touch that.
No.
Senior Services Program. Again, GAR is certainly a special needs program. That's
Yeah.
outside the safety net. It is a special needs program. Senior Services is certainly a safety net program. Services that Youth and Family provides as far as this case management referral is a safety net. ARC is not necessarily a safety net, and Health Festival is certainly a health program, but it's not it's more referral based. Or
That's
one
it?
time.
Yeah, that's it, right?
That's it.
That's all of
So
it.
when yeah.
That's it. So the only one, I guess, the gray areas are, the home enactment, Camp Rosie, but we weren't.
some of these we actually went up on to 3,000. So can we agree on at least giving them the same thing as last year? That'll
Went up on someone?
Yeah, 2 or 3 of these went up.
Okay, can
Which
we
ones?
please, can we just
we at
go
least
back
get
and
back
just,
to the
please?
original?
Yes, I don't think City Council is going to fault us for that.
I think fair housing, well, that was something you suggested, with them.
We had to do anyways.
We had to do that.
I'm sorry, do you have a
Okay.
specific program that you would like?
What are
me
you
to-
referring to? Fair housing we
think
can't
everything was
touch
cut.
because it's a federal
Well,
requirement.
yeah, fair housing went from 75 to 9.
We can't touch that.
Can't touch.
apparently.
Okay.
Look at Star, I mean, we're keeping it 16 and we're keeping it 15.
Star, you said is gray, right? I'm sorry, I'm going to say it. Eliminate Star. Is there going to be blowback?
Show you what that looks like. With that, you would actually
coming
be,
at your house tonight.
That's seriously.
Oh, $1,000.
I don't think that's a good idea, Mr. Sinanian. Only one reason. We're getting rid of both police activity
Yeah.
programs. The boxing and the Star. Those are the only 2 police activity programs we have.
I mean,
that's-
versus what though? I mean, what are the options?
I don't even know if we have an option.
That's what I'm saying. When we take out Star, what are we left with?
if we take out Star, we're left with a surplus of $1,000.
Can we sweeten someone's pot to make the city council happier?
Senior
That's
program.
possible.
We're not, I mean, not sweetening to.
No, I mean,
We
if,
want to
if
make
that's
sure
possible,
that
that's
the-
what I'm saying. If it's even possible.
Well, the biggest cuts were for youth employment and ARS, community outreach. I think both had 35%.
And those are
Reductions.
both frontline.
Those are frontline programs. So if you want to split them 500 and 500, I don't know.
I would be fine with it. Again, this is, no matter how this ends, we're going to walk out of this room dejected.
Okay, can we, I mean, I know nobody wants to hear this, but we have Salvation Army, we have Home Element, and we have Club Jam. There's 3 after-school tutoring programs. And we're not touching after school, I mean, we're not touching Salvation Army or Home Element.
Those are different age statistics. That's why we.
They're all the same ages.
Also, I want to
All
point out
three.
with respect to
No, they're all the same.
Same
they're all
age.
same ages. I want to point out something with respect to Home and with the elimination of New Horizons. That whole area, there's a vacuum there. If Home is
No, I'm not saying eliminate, but I'm just saying be fair. We cut 35% on all.
we've already cut 35% on.
No, we gave them 15 last year. We're keeping it 15. No,
Also, remember.
and we're keeping that with zone. I mean,
We already cut them.
No, that can't be the case. We cut them.
we.
You can
pretty
just
sure.
speak into that one.
Don't
are you gonna say?
forget the distance of how far apart these people are. Club Jam is next to Hoover High School, and Home and Admin Ararat is down on San Fernando.
True.
These people cannot convert from. You also have to keep in mind.
So Club Jam is in a more affluent area than Home and
Yeah, I mean, these people will not be able to convert back and forth that kind of distance. So I don't think those 2 are touchable.
So let's make sure we've been fair to everyone. Was Home and Admin cut 35%?
Just a clarification, no, it wasn't. I don't think it was cut 35%.
It was
cut
only cut $267.
Right.
Okay, let's cut 'em 35%.
Just a clarification, Club Jam and Zone are true, I guess we would say after school from dedicated hour from 3 o'clock, and Club Jam is actually from 12 to 6. I know Home and Emin is, as I mentioned, 1 hour Monday to Thursday, so just, it's not necessarily all apples to apples.
Right.
So it's
Well,
just-
let me ask this. Just a few minutes ago, I think this is exhaustion getting to us. A few minutes ago, we're talking about $1,000. Yeah,
Surplus of $1,000.
We were done.
right here.
Why are we talking about this?
Why, we're finished.
Okay, I'm okay with this. I'm willing to just submit to this because
And you have to leave.
The suggestion was, if you looking at after school, again, the biggest cuts were, not after school, but biggest cuts for youth employment and community outreach. We want to split the $1,000 there and add the 500. It was the 2 that were cut 35%. And Club Jam, actually, I believe.
someone
So-
can offer another configuration right now.
Well,
I'm sorry, can you speak into the mic? Thank
The
you.
after-school programs, we also have to keep in mind how far away we are.
I agree with you.
So you can't cut them out just because there's 3 of them. One on Southern Glendale, Northern Glendale, it's about a 7 to 10 mile difference between.
And we are a city of population of
Population,
200,000 plus,
yes.
so.
So that's, I just say add that $1,000 to the youth program and finish it off.
I'm fine by it.
Added where, Alex?
Glendale Youth Alliance?
The Glendale Youth Alliance, that's the one city cares for the most, I believe. Am I correct?
Which one did you propose?
Glendale Youth Alliance.
GYA.
GYA.
What number are you talking about?
Number 12.
Number 12, Gary.
Number 12?
Number 12, that's correct. Because that took a devastating hit from previous.
Yes, I can be with that.
What's the, add the 1,000 to them?
That's the,
They took a $36,000 drop from
yeah.
last year.
Plug in 51.
okay. How do we balance out now, Iris?
That's, one more zero.
Sorry.
May I ask an irrelevant question, if you don't mind? Why is last year's numbers like 9,253? How'd you guys come up with those numbers last year?
Yeah, the numbers were cut because there was a actual further reduction. So after you deliberated last year, there was another cut.
We
Yeah,
agreed to just
probably
apply
that's
to.
why.
We can't even come up with even
So you have
numbers.
those uneven numbers.
We had,
We
That
did,
would
so
have
you
been
understand.
difficult to actually
we
come
did it
up.
twice around.
Twice,
Okay.
yeah.
Twice,
Yeah.
that's right.
With the current recommendations, we are at 0.
At 0, fine. Okay, let's get on with the
290.
motion now then.
Where?
290?
Here?
290?
Okay, do we have a motion for this? Motion to approve?
Oh, I need to.
Are we all okay with the recommendations?
Yes.
I'm going to read the recommendation, but we want to just double check the math here a little bit.
Okay.
I'm not familiar with this.
So if someone could make a motion, we can read the motion to the effect to move approval of the program as recited by staff, and then we'll read each individual recommendation, then we can have a vote.
Each one has to be read and... is that-
Hidalgo does that.
Oh, okay.
I think so for clarification purposes.
Alex, you're closest to the screen. Can you...
Okay.
Can we do this?
I got the worst eyes, though. Honestly, I couldn't even see it from there. But
Okay. Are you ready? Would you like me to read
that would
the decisions? Okay.
be very helpful.
Sure. Just one moment.
I need to interject. I really have to go have a plane to catch. My answers would be yes on all of these. So if that's okay?
Make it real quick.
Is that okay?
Sure.
Should be okay. 3 of us can
I-
vote anyways.
Okay.
It's because it's...
Yes.
Okay.
We have majority vote here anyway.
Okay.
We'll make a record of that.
That's correct.
Okay, the recommendations that have been made are as follows. Homeless Women and Children's Transitional Housing Program, Door of Hope, $19,000. After School Program, Club Jam, $23,000. Habitat for Humanity, Maryland Mini Park Eco Garden Neighborhood Services, 0. The Zone After School Program, The Salvation Army, $15,000. Glendale Housing Now, Path Ventures, 0. After School Tutoring, Hominid Men Glendale Ararat Chapter, $15,000. Fair Housing Program, Housing Rights Center, $9,000. Intervention Prevention Clinical Group Counseling, CASPS, 0. Loaves and Fishes, Homeless Prevention, Catholic Charities of Los Angeles, Inc., $40,000. Youth Health Services Project, All for Health, Health for All, 0. Mobile Library Services, Glendale Public Library, 0. Youth Employment Program, Glendale Youth Alliance, $51,000. Homeless Outreach and Case Management, Essentia, $30,000. Rosie Goes to Wall Street, Camp Rosie, Commission on Status of Women, $10,000. Glendale Police Activities League, PAL, YMCA of Glendale, 0. Students Training as Role Models, STAR, Glendale Police Department, 0. Community Outreach Project, Armenian Relief Society of Western USA, Inc., $38,000. Multicultural Program and ESL Classes, Glendale Association for the Retarded, $10,000. Senior Services Program, Glendale Community Services and Parks Department, $20,000. Youth and Family Services Program, Glendale Community Services and Parks Department, $10,000. Create Freedom and Awareness Youth Seminar, Arc Family Center, Inc., 0. Glendale Health Festival, Armenian American Medical Society of California, 0. Those are all.
Okay, so you need a motion then. I move that we accept the funding recommendation as read by the recording secretary.
I'll second that motion.
I'll take roll call. Committee members Cornell,
Yes.
Oganessian,
Yes.
Olivares is absent, Sinanian.
Yes.
Chair Markarian has left the meeting.
Can we make record of the fact that Chair Markarian, before she left, expressed her consent and agreement with the recommendation? That may not count as a vote, but nevertheless, just to get it on the record.
So noted.
Thank you.
Can we also put it on the record for everybody watching that I personally am extremely sorry for some of the programs that got left out. I hope everybody could understand what kind of situation we're facing here. And I'm sure my colleagues here would feel exactly the same way I do.
I think it was very well put, Alex. This was the most painful experience in my 4 years that I've been on. I have the privilege of being on this committee now. It's not easy. It was challenging. Hopefully, it won't get any worse next year.
I agree with both my colleagues. I've been on this board the same amount of time as Committee Member Cornell, and this was just very painful. And we're going to go out into the community after this and somehow have to account for what happened. Yeah, but there's absolutely no better option, at least not one that we could come up with today.
Before we adjourn, I want to thank staff, and particularly Iris, for the lunch and beautiful arrangements and taking care of everything, and for the beautiful job you did. And see, Mr. Durain has a message.
Ask her what's next.
Next item on the agenda.
Oh, okay. With that, the meeting stands adjourned.
I'm sorry, Mr. Cornell, if I may. There are a couple of other items, if I can read them into the record. There's two more items on the agenda.
Items? Oh.
Item number 5 is other business. Do we?
I think you had some other business. Glendale Healthy Kids, no?
Oh, well, I think I had one for Healthy Kids, and I move that the meeting is back in order here. I had something for Glendale Healthy Kids. It's a health fair. It's March 24th, and it's put on by various sponsors, Kiwanis, Rotary, even the chair's employer, GMAC. And if you need any further information on this, feel free to call Glendale Healthy Kids at 548-7931. And I don't have any cards in front of me, so there is no request for public communications then.
Right, item 6 was public communications. I don't have any cards either.
Okay, and with that then, I'll make it official this time and adjourn.
Thank you.